Start, Tulika. Go ahead.
So, Chitrakala, can we start?
Yeah, sure. Yes, sir.
Yes, sir, we are live now.
Yeah, thank you, Chitrakala. Good evening, doctors. I welcome you to today's webinar on a pleasant evening on the topic of crossing barriers of breastfeeding, supported by the Gorakhpur Obstetrics and Gynecological Society and the Gorakhpur chapter of Indian Society of Perinatology and Reproductive Biology. Also, Indian Society of Perinatology and Reproductive Biology, and also supported by Shield Connect. So let me welcome today's our organizer and moderator, Amrita Sarkari Jaipuriar ma'am. We are very honored and privileged to introduce her, ma'am. And she's a consultant gynecologist and obstetrician at Jaipuriar Medical and Research Center and Garg Hospital, Gorakhpur. And she completed her MS in Obs and Gynecology, DNB and FICOG. Coming to the present post, held our president at Gorakhpur Obs and Gynecological Society from 2021 to 23, and secretary at Gorakhpur Menopause Society, and secretary at ISO PRB Gorakhpur chapter. And she's the organizing secretary for Workshop Maternity Mortality NJYC at 2010 and Saving Mothers Conference 2019 SAFOG. And she's the editor of all the 7 years of above conferences. And she's also organized a hysteroscopy workshop in 2017 in gynec and endoscopy workshop at Garg Hospital, Gorakhpur. I invited faculty in various conferences and CME and presented papers in ASCOG, FIG and UPCOG, and got the best paper award in UPCOG 2020. And coming to the publication, original research publications in World Journal of Pharma and Research and International Journal of Medical Sciences. Coming to the, she is a member of PCOS Society, GESI, ISCCP, IAG. And coming to the awards, she from the Economic Times Most Promising Gynecologist of the Year 2021. So with this, we welcome you, ma'am, and I hand over the session to you to take further ahead. Thank you.
Thank you so much for the huge description, and good evening, all of you. I welcome you all on behalf of Gorakhpur Obs and Gynae Society, Gorakhpur chapter of ISOPAB, and Indian Society of Perinatology in this wonderful webinar on breastfeeding. So when a girl grows into a lady and becomes a mother, she is exposed to too many responsibilities suddenly. And she also wants to be a perfect mother or the best mother. So it's the family's responsibilities also, the society's responsibility also, and our responsibility also to help her in proving that she's the best, or at least no less. The theme of this year's, we are celebrating Breastfeeding Week. And the theme of this year in 2021 is Protect Breastfeeding, a Shared Responsibility. We all know that global breastfeeding rate is still very low. Only 41% of infants below 6 months are exclusively breastfed. The aim of this webinar and so many others all over the country, everybody is trying to do their best in this context only. So now when we know that most of the infants are not being exclusively breastfed, we should look into the barriers of breastfeeding and trying to find a solution. Today, we have a galaxy of brilliant faculty. And before that, let's invoke Lord Goddess Saraswati and lighten the lamp before starting the pursuit of knowledge.
या कुन्देन्दु तुषारहार धवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना अच्युतशङ्करप्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा शुक्लां ब्रह्मविचारसारपरमा आद्यां जगद्व्यापिनीं वीणापुस्तकधारिणीम् अभयदां जाड्यान्धकारापहा हस्ते स्फाटिकमालिकां विदधतीं पद्मासने संस्थितां वन्दे तां परमेश्वरीं भगवतीं बुद्धिप्रदां शारदाम्
As I already said, today we have an amazing faculty. Dr. Madhuri Patil, Secretary General FOXI, Dr. Tarini Taneja, President UPCOG, Dr. Sneha Buhar, Chairperson, Female Breast Committee of FOXI. Faculty as chairpersons, speakers, panelists, they are obstetricians and pediatricians, neonatologists from all across the country. Dr. Sunita Kumar, Dr. Mala Srivastav, Dr. Radha Jinna, Dr. Mahima Mittal, Ekika Singh, Dr. Ritu Sinha, Dr. Geeta Gupta, Dr. Mohit Agrawal, Dr. Shelly Agrawal from Kanpur and Dr. Shelly Agrawal from Noida, Dr. Sangeeta Pahwa and Dr. Tulika Jha. So now I would love to call upon the designer of this program. She's none other than Dr. Sadhna Gupta. She'll take us through all the barriers of the breastfeeding, and then we'll get to know what to do. Over to Sadhna Gupta, ma'am.
Thank you, Amrita. First of all, as a president of Gorakhpur chapter ISOPAR as well as organizer, I welcome everyone on the board, chief guest, Dr. Madhuri Patel, guest of honor, Dr. Tarini, Dr. Sneha, and all faculties, chairpersons, speakers, and all over participants who are with us on this journey, that crossing barriers to breastfeeding. And Dr. Amrita, like all over the week, we are talking about it, FOXI, ISOPAR, every UP chapter, everybody is talking about it. And so many times we used to think why there is so much talk about it, because breastfeeding is a natural thing. It is not. It is a natural for Indians. It is natural for mothers. But what the incidents, what our data says that India is still lagging behind in many targets, and Western world can go ahead with even any sort of feeding, that is dog feeding, but the developing world, the so much diverse country like India, how much breastfeeding is crucial for mothers, for babies, for adolescents, for reproductive age women, and for the future adulthood, that is non-communicable disease, obesity, and cancers. We have so many things. It is not a, what is a theme of this year, that is, it is shared responsibility, because it is much beyond the responsibility of doctors only. It is communities, it is politics, it is legislation, it is women's rights. So there are so many barriers, and first of all, when we want to open any barrier, we must open our heart and brain and soul to that. We must ourselves be open-minded for that. So we are going ahead with the, I think will be a brainstorming, innovative, thought-provoking session. So once again, a warm welcome and a hearty welcome to Dr. Madhuri Patel, who has so graciously, despite her busy schedule and the so much responsibility of being Secretary General of the FOXI, and we welcome you, Dr. Madhuri, and we are heartful. We are very much thankful for your presence, and it is my real pleasure to introduce Dr. Madhuri Patel. Can I have Tulika's slide of Dr. Madhuri Patel on the screen? Dr. Madhuri Patel, she is Secretary General FOXI, and this is one thing very, very important we want to share to all, that she is the first female Secretary General of the FOXI. And here it comes that how we have to cross so many barriers. We still don't have a USA women president, and we have the first Secretary General, Dr. Madhuri Patel. And being on this, we actually look forward for many opening the doors and windows in FOXI. So she has been Joint Secretary FOXI 2009, former committee member Figo Pritam Bhatt, Associate Editor of Journal of Obgyne of India, Honorary Clinical Associate Naraji Wadia Hospital, Honorary Consultant Police Hospital, Visiting Consultant and St. Elizabeth and Messina Hospital, and former Professor and HOD at ASIC PHI MSR Bombay Hospital, Bombay. Former Associate Professor GMC India, and she has delivered many keynotes, oration, and more than 50 publications in national and international journals and books. And she has been Associate Editor of FOXI award-winning book Gynecological Cancer 2007. Above all, she has been the friends of friends. I remember when I was just new in the Gorakhpur Society and like attending meeting, and she was, I think, the first few one who gave me opportunity to be participated in when Dr. C.N. Purandare was president in cancer workshops. And so many times we got her phone, and we are really indebted to you, Dr. Madhuri Patel. Very simple, very humble, but a firm person. So welcome, Dr. Madhuri Patel. We would like that you give your some inspirational message and your best wishes to our program, Dr. Madhuri Patel. And she has been the past chairperson of Female Press Committee. She has not mentioned in the CV. So Dr. Madhuri Patel, please.
Dr. Sadhna, thank you very much for your kind and generous words. And I must also thank Tirupa, no? What's the name? Your Tirupa, for also the kind words. So respected Dr. Sadhna Gupta, organizer, President Gorakhpur Chapter ISOPAP, former Vice President FOXI and support. And my dear FOXI friends since last 14 years, as she has already mentioned, that I was Joint Secretary to Dr. C.N. Purandare, my mentor. And we had almost 200 workshops. And Dr. Sadhna and myself, we have really gone many places to give these lectures. And really, we have association since last 15 years. And Sadhna, I'm really thankful to you for all the activities you have continued along with me. And we are very happy to share each other, all the personal as well as the professional, matters. Then we have a guest of honor, Dr. Tarina Taneja, chairperson of ISA, Delhi, President, UP Corp, and my dear friend. And you believe me, we have become FOXI friends and then family friends. And we have attended each and every family function of Dr. Tarini's house and my home, So we are such thick friends. And let me tell you, after me, she became the committee chair of the breast committee, chairperson of the FOXI. And she has also done the excellent work. Then we have Dr. Sneha Bhuyer. The way she is working now since last 3 years, you can see everywhere, breast committee, FOXI, chairperson, Sneha Bhuyer, everywhere she is seen in FOXI. And of course, she is very hardworking, very sincere, very meticulous. And overall, she is very, polite. So Sneha, I'm really happy about your committee work. Then we have Dr. Reena Srivastav, patron, Gorakhpur chapter of ISOPA, President, Gorakhpur Menopause Society. Then Dr. Amrita Jaipuria, President, GOGS and Secretary, Gorakhpur chapter ISOPA. Dr. Aruna Chaparia, Secretary, GOGS. Dr. Babita Shukla, Vice President, Gorakhpur Society and Clinical Secretary, ISOPA. Chairperson Dr. Sunita Kumar, Dr. Mala Srinivasa. Dr. Mala, I had interacted last year when she was president of her society, and we had a very good function on the Women Health with Minister, and she has really arranged so well, and she is also active in journal. Then we have speaker Dr. Mahima Mittal, moderator Dr. Sadhana Gupta, panelist Dr. Kika Singh, Dr. Ritu Sinha, Dr. Geeta Gupta, Dr. Sunita Kumar, Dr. Mohit Agarwal, Dr. Shaili, both Shaili. The spelling only there is I not there in one, but otherwise there's Shaili and Shaili Agarwal. And then we have Dr. Sangeeta Pawan, Dr. Tulika Jha, and Indian Perinatology Committee, all the team members, all my seniors and juniors. Very good evening to all of you. I would like to express my heartfelt gratitude to Dr. Sadhana Gupta and her team and Indian Perinatology Committee for inviting me as a chief guest for today's most wanted webinar on crossing barriers of breastfeeding. And here I would also like to mention one of the mythological stories which I have heard and read, that when Kansa dispatched his sister Putna to kill Lord Krishna when he was just 6 days old by breastfeeding him with poisoned milk. But when Putna sees Krishna, divine thoughts enter in her mind. She experiences a joy and sense of fulfillment which she had never experienced before. Overjoyed Putna takes child Krishna and says, I will give you all, my beloved child, I am yours. Krishna survives. So these are the mere thoughts of breastfeeding evokes multiple unmeasurable reaction of joy in mothers. And remember, breast milk is a natural nectar of life. Few years back, a famous magazine from Kerala published a photograph on front page showing famous model Gilu Joseph with an infant and her open breast with caption, Mother tell Kerala, don't stare. We want to breastfeed our child. It is the right of the woman to breastfeed her child in public without hesitation. We salute all the mothers who actively participated in breastfeeding and giving India a healthy generation. It has been pointed out that globally there are only 41% of the mothers they breastfeed their infants for 6 months. So we have to reach our SDG, not SDG, but we want at least 50% of the mothers. They should breastfeed the infant at least for 6 months by 50%. So we have to have awareness program not only in our community but also in public. There are certain myths about breastfeeding, like breastfeeding makes breast safe, breastfeeding hurts, one should separate a newborn and mother to let the mother rest. Mother won't be able to make enough milk, etc. So we have galaxy of eminent speakers, chairperson, moderator, and panelists who will enlighten us on the solution of myths and importance of breastfeeding in scientific manner, which will definitely help all of us to for the clinical our clinical practice, and it will in turn help our mothers. So therefore, I congratulate Dr. Sadhana Gupta and her team and Indian Perinatology Committee for organizing relevant webinar, and I wish them best. Happy learning to our all delegates, and I would like to take an opportunity to say as a Secretary General that any assistant in FOXY, if you want it, I am there to serve you. My all details are there on website, that is foxy.org, and you will find my number and email, and just tell me whatever problems you have, what you want to perceive, what you want to go ahead, how to go ahead in the FOXY. I'm definitely there, and then you please give me opportunity to serve you. At the end, I would like to say that breastfeeding is a mother's gift to herself, her baby, and also the earth. Hence, let us join hands to help our mothers to achieve it. Thank you very much.
Thank you, Dr. Madhuri. It was really inspirational, and you covered so many from the from the Krishna era to the today's issue, like the figure and the so many things. So thank you, Dr. Madhuri. It was wonderful. It was really we are really blessed to have you as a chief guest in this session. And I invite Dr. Amrita to go ahead with the introduction of guest of honor. Dr. Sneha has not joined, so I think you introduce first Dr. Tarini Taneja.
Thank
Thank
you,
you,
ma'am.
Sadhna, once again. Thank you, Sadhna, once again. And I
Yes,
will
Sadhna.
leave after some time because I have to attend another webinar.
Thank you.
Thank you, Dr. Madhuri Patel, for sharing your wisdom and your precious time. And now I would invite Dr. Aruna Chaparia for the further proceedings to introduce Dr. Reena Srivastav and move further for the academics.
Dr. Tarini, Dr. Sneha, when she joins, we
Doctor-
will introduce her, and Dr. Tarini Taneja will be introduced at the moment. When she
Dr.
joins, then yes.
Okay, ma'am. Dr. Aruna Chaparia is the secretary of Gorakhpur Obs and Gynae Society, and she has held many posts in the past. She is also the director of Chaparia Hospital, and she is a very eminent gynecologist and a great secretary for GOGS. She is an asset. Over to you, Aruna.
Thank you, Amrita, for your kind words. A very good evening to all of you present here. And indeed, it's my pleasure and privilege to read about Dr. Tarini Taneja. She is awardee of Bharat Gaurav Samman and Wonder Foxian Award. She is chairperson Delhi State ISAR, president OBGY Society UP chapter, president-elect Ispat Delhi chapter, president OBGY MZN 4th times, executive ISAR 2018. She is also chairperson Breast Committee FOXY from 2013 to 2015, international member FIGO Working Group Breast Disease, president NGO Manjil E. Rahat with prime goal to prevent female feticide, board member Journal Obs and Gynae Research and Practice. Many publications goes to her credit. She is also vice president DMA Women Wing, RCOG associate member, and currently she is doing research on platelet-rich plasma. Welcome, Dr. Tarini Taneja. I request you, ma'am, to say few words of blessings.
I'm really lucky मेरा network चला गया I could listen आशा तुम्हारी आवाज सुन के आ गया है I'm really happy to be reconnected. First of all, my vibrant evening to each and everyone connected here, all the organizers, guests, faculty and delegates, and the person who has provided this platform to us. So thank you so much, dear Dr. Aruna. Probably,
Thank you.
I'm really my heartfelt gratitude to Dr. Sadhna for sharing the dice with Dr. Madhuri. She is my mentor. I'm really pleased to be here, and congratulations, Dr. Sadhna, for such a wonderful webinar for such a very important issue, crossing the barriers in the breastfeeding. So this is the public interest issue. Moreover, it's a good for the mother and baby as well, for the family, for the society and country. So it's a very, very important issue. Why we don't know why we have lost the interest in breastfeeding. So there are many barriers according to the population. So in which area we are dealing, like in the rural area, in the modern city area. So depending their locality and their culture, there are so many taboos and myths. And if we talk about the rural area, they are the culture myth. so many celebration and so many things like वो पहले वॉश करना है निपल को, तभी बुआ करेगी, चाची करेगी, जो भी करेगी वो आएगी 2 दिन में 3 दिन में, उसके बाद में so they miss the first golden hour to give the breastfeed. Then if we talk about the like metro cities, there are the career oriented women, and if we go like the model, they are the very conscious for their figure. So many they opt, though everything is normal in their, they can conceive, but they are opting for the surrogacy. So we are living in a very different, now the very different spectrum. Why we are losing the interest and so many barriers, and they are definitely very, जिसे कहना चाहिए, real problems with the women who wants to feed, like the nipple sore hona and engorgement, yeah, blockage of the duct or malnutrition. So all the there is not proper milk production to give the child. So what we can do, first we can just educate them, awareness. We should have to tell them the significance of this breastfeeding is not only convenient and cheaper, but is very good for the child health and is also for the female itself, mother itself. So we should give the like importance of the first hour. That is the first hour she crawls on the chest and the breast of the mother. There is a skin to skin contact. Then it gives the very emotional bonding between the child and mother, and also the initiation of the successful breastfeeding. And second issue, that is the called liquid gold, that is the colostrum. If we tell about that, the colostrum is act as a first vaccine. So it's a full of the antibodies, so better to say powerhouse of the antibodies. So child become very, it prevents from the sickness of the child. We all know from the like respiratory infection, gastroenteritis, also the obesity is not there of the child, diabetes is also not there. And in the mother also, mother regain it's important for the mother, there is a contraction by uterus, then there are the chances of postpartum bleeding is very, very less, and mother regain the pre-pregnancy weight. That's a very important, and it acts also as a contraception. So it's a natural act as a natural contraception at least for 6 months. So, and also the one of the barriers that presently would be facing, the fear of the corona. So I feel we have to remove the fear of the COVID time, how they can get the vaccine or they can like feed the baby with the all protocols of this COVID time. And one thing more, I just need, there is a need of the human breast milk bank. So especially for the women who are badly sick, like they are the cancer patients, or they are suffering from some like viral, just a COVID time, they don't want to give feed. So other time when they are healthy, they can give, or meantime, anybody can take milk from there and feed the baby. So I would like to hear more from the expert panel and our speaker from the AIMS, I think Dr.
Mahima Mitra.
Mahima, Dr. Mahima, I would like to hear. And again, many, many thanks to Dr. Sadhna for giving this opportunity. और मेरा नमन बार बार again and again तो actually मेरा connection जा रहा था तो Dr. Jeena ma'am, Reena ma'am, and Babita Shukla, Amrita, Aruna, and Reena ji, and also my friend Dr. Mala Shrivastava. Other friends also there in the panel. But probably I'm losing my connection. Am I audible? Hello?
Yes, ma'am.
Yes, ma'am.
Okay.
Yeah,
कुछ नहीं आ रहा डॉक्टर साधना. I was literally very scared. मेरे ख्याल से दिल से तुमने बुलाया, दिल से मैं जुड़ी तभी कनेक्शन आया, नहीं तो जा रहा था। मैं डॉक्टर माधुरी को मिस नहीं करना चाह रही थी, पर कुछ वर्ड्स मैं उनके सुन पाई। अगर रिकॉर्ड किया हो तो प्लीज मेरे को रिकॉर्डेड मैसेज दे देना। और डॉक्टर माधुरी नमस्ते।
नमस्ते
डॉक्टर माधुरी
नादारिनी।
नमस्ते। बिल्कुल
नमस्ते,
आपसे मिलने की वजह से शायद कनेक्ट हो पाई हूँ मैं, ये तो मेरा कनेक्शन चला गया था, ट्रेवल में हूँ। So congratulations, Dr. Sadhna, for your endeavor, whatever you're doing. And thank you so much for giving the opportunity to share the dice with my mentor, Dr. Madhuri. And I'm feeling at home like from the Gorakhpur, as naturally all my alma mater people are there, Dr. Jeena, Dr. Reena, and other Dr. So, Dr. Madhuri, you're looking literally very pleasing. Bye-bye. Bye, Dr.
I think we must thank Sadhna that she has given us the opportunity to talk to each other in the busy schedule.
Yeah.
So, Sadhna, we are very, very
Dr. Madhuri, I again want to do personal
Bridging.
congratulations.
Bridging
Linda
between
as
the-
a Secretary General.
Thank
I
you.
need a party also.
Thank you, everybody. All the Gorakhpur
Okay.
Society will also
So
get.
thank you. I want to listen now to speaker.
Thank you, Dr. Madhuri, and I'm happy that we have started with bridging the gaps, and I really want to be bridge between so many gaps. So, bridging the thank you, Dr. Tarini, thank you, Dr. Madhuri. I think Dr. Sneha Sneha, you have joined because she says that she is just joining. I'm looking that she is from other mobile. Thank you, Dr. Tarini, once again that you, despite your all travel and highways, and we could listen
नहीं
you.
नहीं,
well.
मुझे बहुत अच्छा लगा. I'm feeling good. I'm here. I could reconnected. मुझे बहुत बुरा लग रहा था. Thank
So
you.
I
Always a
think,
pleasure to
uh,
meet Dr. Tarini.
Dr. Sneha, are you there? It's from the other phone. Actually, I was just thinking. She is not joining. I think, Amrita, we can go ahead with the next program, and whenever she joins, we will introduce her. So please go ahead.
So we quickly move on to the academic session now. And for this, I'll call upon the chairpersons for this webinar. The topic is Journey of Breastfeeding Programs in India, a review by Dr. Mahima Mittal. And the chairpersons are Dr. Sunita Kumar. May I have the CV, please? Dr. Sunita Kumar is ex-superintendent in Chief District Hospital, Gorakhpur, and she has worked for the lactation management, and she has conducted various health camps in our city, and she has a huge experience in neonatal care, the pediatric care, and breastfeeding promotion. May I have the next slide, please? Our another chairperson is Dr. Mala Srivastav, and you can see the list of awards and the posts she has held. And she's a senior consultant and professor, Gangaram Hospital at Delhi. And she's a gynae endoscopic and robotic surgeon. And she's the past president of AOGD 2020 and to 2021. Her areas of interests are many: gynae endoscopy, oncology, and robotic surgery. And she has had many special trainings for that. And she has been awarded as APG Abdul Kalam Excellence Award. And many other awards are there in her credit. And we can think of any committee connected to gynecology. She's a member or a chairperson or an executive of that. So I welcome you, Dr. Sunita Kumar. I welcome you, Dr. Mala Srivastav. May I have the slide of Dr. Radha Jina, ma'am, please? Our chairperson, Dr. Radha Jina, she has retired from BRD Medical College, Gorakhpur as professor and head. Sorry, she has not been the head, but she was the professor of Gynae. And she has many national and regional papers to her credit. She has been the past president of GOGS also, and she has been the president of UP chapter of Obs and Gynae. She has been felicitated by many organizations, newspapers, and is the chief patron of Foxy Saving Mother Conference. She has been the chief patron of Foxy Saving Mother Conference, and she's also a patron of Gorakhpur chapter of ISOPA. So over to chairpersons for further proceedings.
I would request Dr. Sunita Kumar to introduce the subject, the journey of the breastfeeding programs in India, a review. And Dr. Radha Jina ma'am, I would request you to introduce our speaker. And finally, Dr. Mala Srivastav will conclude the subject. So ma'am, Dr. Sunita Kumar ma'am, please introduce the topic.
I can be heard? Can I be heard?
Yes, ma'am.
Now, myself, Dr. Sunita Kumar, I worked in Women Hospital for the last 30 years. And from my experience, I want to say that since I have worked both with the mothers and the children, that we want to cross the barriers of the feeding the baby exclusively for 6 months, and the failure in exclusively breastfeeding is mainly due to either in the initiating the breastfeeding or at the after 3rd, 4th month. That is what I have experienced. Either she faces hurdles in the first few days of starting the lactation, or she feels herself inadequate after the 3rd or 4th month. So what I suggest is that we have to break the barriers which she faces either in the initial stage of lactation or in the later part of the lactation, which are becoming the major hurdles in crossing the barriers of the breastfeeding. That is the initial phase. By initial phase, I mean the problems faced by the mother, like the problems in the nipple or mastitis, mastalgia or abscesses, or various kinds of problems which are faced by the mothers to start the lactation. If she gets a help right in the labor room or at home to start the lactation and to continue it, she might not withdraw from the breastfeeding process. And after, what I have experienced is that after 3 to 4 months, she starts feeling somehow, all the mothers. And when they come to us also, they say, now the feed is inadequate for the baby. And now they would start a top feed for the baby. They want to put the baby on bottle or some other feeds. So that myth has to be broken that after 3 to 4 months also, till 6 months of age, the breast milk is adequate for the baby in spite of diarrhea and diseases and all the negativities that the baby is facing up to 6 months of age. She has to continue the lactation. So what I want to say is, since I'm sharing this platform with most of the gynecologists here, that this problem can be solved by giving a counseling in the last trimester of pregnancy to the mother, because once there is a delivery that has occurred, there are so many other problems with the mother and the relatives that they are unable to hear such a small thing that breastfeeding should be started within 1 hour of the delivery. So what I suggest is that in the last trimester of pregnancy, all the mothers, they should be given a counseling of the starting the breastfeeding as soon as the child is born, and that it should be continued up to 6 months of age. Once this is done, and all the antenatal cards should have a column which mentions that antenatal counseling regarding breastfeeding has been done. Now,
Thank you. Thank you, Dr. Sunita. Dr. Babita, Dr. Sneha has joined. So before we introduce Dr. Mahima, welcome Dr. Sneha. So we will invite Dr. Reena Srivastav to introduce our guest of honor. Sneha, welcome and hearty thanks for this week. Must be very busy for you as a chair breast committee, and we once again we are all with you in your this endeavor and your aims and like dreams for having 100% breastfeeding. So Dr. Reena Srivastav, please introduce Dr. Sneha.
First of all, there's no need of this introduction, Amrita.
Dr. Sneha, please flash, Atulika, flash the CV of Dr. Sneha Bua.
Yeah, sure. First of all, my congratulations to all of us for India bagging the gold medal in
Ah.
javelin throw today and a silver medal in wrestling. It is a great day for India. And apart from 6 other medals which have been bagged by all of Indian players, my congratulations to them as well as all of us. And I hope these sportsmen have had their breastfeeding. They must have been fed by their mothers, because the strength they have shown in Olympics must have come from the breastfeeding by their mothers. This was the message for today. And with this, I would like to welcome Dr. Sneha Buar. You know, all of us know her. She's meticulously working, and she's working so hard in this committee for the last 3 years. Everywhere there is Sneha, Sneha, Sneha. And today, definitely, Sneha, you are here because the elixir of life from mother goes to baby, and that is out of all the sneh she gives to her mother, to a child. So Sneha, to introduce her, she is at present chairperson of Female Press Committee, FOXI 19 to 21, and she's carrying the chair so brilliantly and so meticulously, and she's working very hard for the best studies. She's governing council member ICOG 21-22. She's associate member of Royal College of Obs and Gynae, London, and managing director of Sukarta Hospital with 29 years of experience in government medical college as well as private practice. She has delivered more than 300 talks at national and international conferences, and more than 25 articles to her credit are there. She is recipient of National Award of FOXI, Unsung Hero, State Award like Dr. Andy Joshi of Maharashtra State, then International Signature Award for Phenomenal Leadership in 2020, Lokmat Excellence in Healthcare Award for Excellent Health Services in Maharashtra in 2020, FOXI Wow Award for Excellence in Healthcare.
So much.
No,
thank you so much.
There is a big list of awards to her credit. My all warm welcome to you, Sneha, and we'd like to listen from you. I know you have been very busy throughout this week too much, and that blessings are needed for this webinar also. Thank you for your kind appearance.
Thank you so much, Madam Reena Srivastava, for that kind and generous introduction, I would say. At the outset, I would like to thank respected President ISOPUB, Madam Usha Sharma, and Secretary General Dr. Meena Samant, and Madam Sadhna Gupta, Dr. Amrita Jaipuria, Dr. Babita Shukla, so many of my friends I can see here. So I'm very happy to be here, and thanks once again to invite me. Right now, today's national event, Lactacon 21, is still on, and we just finished with the inauguration. And I could find time. Fortunately, Madam called me up. So without much ado, I would just say a few lines, because all of you are esteemed faculties, and I'm sure all of you are discussing the subject in depth. So just few words, as everybody is talking about, the breastfeeding is the natural instinct of every woman. It's a dream of every woman. And all of us are knowing and even giving the knowledge to all these women. And still, when we talk about the rate of exclusive breastfeeding, it is only 44% to 55% in some region, when actually WHO has set the goal to 65% by 2025. So why are we lagging behind so much in these SDG goals? And that's the reason it's a matter of introspection for all of us. We are talking about, and most of the organizations, they are recommending that, yes, it should be the initiation as soon as possible, the birth. How soon? It should be, immediately after the delivery of the baby, even before cutting the cord. And that's the very reason Government of India in the Ma initiative is recommending delivery of the baby on the mother's abdomen, and just support the baby, let it crawl towards mother's breast. So that is breast crawl. And if we all following this technique, may it be a vaginal delivery, may it be a cesarean delivery, even in the operation theater, if the baby is fine, not distressed, we can definitely put the baby to mother's breast. That is the most important message, which is not a message, but it is to be followed and brought into action. I think we pledge from today. And then, of course, we need to continue the exclusive breastfeeding for first 6 months of life. All of us know this theoretically, I'm sure, but there are certain practical problems and there are certain bridges, like, the baby is shifted to NICU, or maybe the mother is very tired, and so many other things. So there comes our role as healthcare providers. That is what is the theme of this year, that we have to protect the baby, protect the breastfeeding, and support it. So we have to share the responsibility of supporting the mother. As I have already said, we have to attach the baby to the mother's breast just immediately after delivery. So there our role as healthcare provider comes. We have to train our paramedics, our nursing staff to carry out this activity. And at the same time, we have to teach and involve the family members for the counseling session right from the antenatal period. So it's not the responsibility of the breastfeeding mother alone, but it's a responsibility of the entire family, entire healthcare providers, and as well as the community as well. So I think that's the only message in addition to the routine one we want to give. And we, all of us, if we decide that yes, we all can do this and nothing doing, even if the mother is not well, somebody else can help her. You lie down, you relax. But yes, we can help you feeding the baby. Same is true for the baby who is sick. If at all the baby is away from the mother, it's the duty of the family members, duty of the doctors, obstetrician and pediatrician, both to express the milk and to reach it to the baby. And of course, in addition to this, even when the baby is so sick and they are having some major problems, when you are starting the feeds, it shouldn't be the infant milk substitute, but it should be either the mother's milk, or if it is at a long distance from the mother, it should be human milk from the bank. So I think that should be the message, and that's what we have the aim to carry out, the function to carry out this year. With this, I would like to end my talk here, and all the best for the activity, very good academic activity you all are doing. Once again, best wishes to Madam Sadhna Gupta, and thank you all of you for having me here.
Thank you, Dr. Sneha, for the nice words of wisdom and a very good message to all the attendees and all the faculty over here. And I think the people are working, the obstetricians are working out of it. In Gorakhpur, I would like to tell you that even my child, who is 39 years old, was not allowed to have a top milk. The pediatricians over here are very, very alert, and there is a lot of program going on for the last, if I remember properly, for the last, say, 40 years. It is a hard work of pediatricians and gynecologists and obstetricians over here, and everybody is working for it. But then we have to reach our goal, that is definitely, and we have to be continuing the methodology and the working for exclusive breastfeeding. Thank you so much for your presence, and for you have taken out so much time for all this, all of us from your busy schedule. Thank you so much.
Thank you, Sneha.
Thank you so much.
Thank you, Sneha. And really nice to share by, because Sneha must be leaving, that Gorakhpur has been always one of the first few cities where the breastfeeding activities are being really promoted in the rural and the all areas. So we are really together on the same page. So it's really proud of our city also. So thank you once again, Tarini, Sneha, and Dr. Madhuri Mittal especially for your presence. And Dr. Babita, Dr. Radhajina will introduce now Mahima for her.
I would request Radhajina ma'am to introduce our esteemed speaker.
Yeah, thank you so much, and best wishes to Dr. Mala Srivastav. Bye-bye.
Thank you, Dr. Babita.
First of all, I joined Dr. Reena in congratulating all the Olympians who got medal for our country. Now, it is my pleasure to be a part of this important webinar and to introduce Dr. Mahima Mittal. Dr. Mahima Mittal is professor and head of the Department of Pediatrics at AIIMS Gorakhpur, and she was professor and head of the Department Pediatrics in BRD Medical College before joining AIIMS. She was member of Ethics Committee, BRD Medical College and Regional Medical Research Center, Gorakhpur. She is member of IAP, NNF, and IAPCDP, and ex-member Executive Board, UPIAP. She is member Scientific Advisory Committee, Regional Medical Research Center, that is ICMR Gorakhpur, and she is a trained registered behavior therapist, EULAR course in pediatric rheumatology. She has international and national publications and authored chapter on viral encephalitis. She was a part of multiple projects with ICMR and UNICEF, and presently is a project coordinator in a project with UNICEF. Her area of interest are infant and young child feeding, early intervention in children, genetic disorders, and quality improvement in healthcare. Now, we are going to celebrate the breastfeeding, or we are celebrating Breastfeeding Week in collaboration. We celebrate Breastfeeding Week every year from 1st to 7th August. And today, this is a part of the same activity because we organize various activities from FOXY, and one of them is to organize various webinars. Now, the breast milk is the best milk for the newborn, and it is a source of nutrition for newborn, which contains adequate amount of fat, carbohydrate, protein, minerals, and various vitamins. Now, the early milk, which is produced in the early days, that is mostly within 24 hours, is the golden milk, and it is called as colostrum because it is thick and yellowish in color. And this is the best milk for the baby, and we should put the baby immediately after delivery to the breast of mother, whether she has delivered normally or it is the cesarean section. Now, this colostrum is very rich in antibodies, and it protects the baby against illnesses and also gives immunity for various childhood disorders. Now, breastfeeding is the safest of all because it is clean and it is not contaminated, and it should be as the other top feed, there are more chances of diarrhea, gastrointestinal disorders, vomiting, and also respiratory diseases. So breast milk is the most effective and most ideal milk for every child, and it is our duty to encourage more and more early breastfeeding. And as already told by our chief guest, our guest of honor, and Dr. Sunita, that there should be only and only breastfeeding for first 6 months of delivery. Now, sometimes there are problems in breastfeeding, which may be because of some maternal problem or some problem in the child, because sometimes the child may be premature and may have cleft palate or cleft lip, so may not be able to suck it properly, but it is our duty to see that the baby sucks it properly, and we have to work for that. And sometimes mother may be too ill to feed her baby herself, or there can be sore or cracked nipples, or there can be, if she's not feeding, there can be inflammation of the breast or mastitis. So we have to see for all that. Now, there are certain myths about breastfeeding which we have to remove, and the theme of this is effective
crossing barriers of breastfeeding. And today we have got our speaker, Dr. Mahima Mittal, who is going to speak on, I think, a journey of breastfeeding. So now I invite Dr. Mahima Mittal to speak on her topic. Dr. Mahima, please.
Thank you for the kind introduction. At the outset, let me thank Dr. Sadhana Gupta, who's given me this opportunity to speak on this platform where I can hear from the other side. So we as pediatricians are only thinking about ourselves and what we are feeling and what we should be doing for the babies. And this is a great opportunity where I can listen to the other side of the story and think of some reasons and the mitigating things where we can come together and do something for the babies. So thank you so much for all the organizers. It's great to be among friends and family. And without much ado, let me start with my presentation. I'll be sharing my screen. Is everybody able to see the screen?
It is visible, Mahima. Visible. It is visible.
So let me start with the breastfeeding journey. Like the President Foxy, I think, Dr. Madhuri has already mentioned about the historical facts of breastfeeding. Let me start from the very beginning. So God had made mammals. They were suckling their infants. And these are our forefathers who used to do the same thing. Then how did we come to this stage? This is all man-made, and this is a journey that we are going to see how we came from that to this. So about a brief history about breastfeeding. Short video.
Mahima, are you, is Mahima audible?
Yes. Can you hear?
Yes, now, yes, yes.
Can you see the video? Everybody is able to see the video?
Not now.
Yes, ma'am.
Now, yeah.
Not now.
Yeah, I'll just
Sometimes it is.
The previous video we saw.
Just a moment. Just bear with me.
We can see the video. Is there any music with it?
Yeah. Can you hear the background thing?
No, no, no.
No, we can't hear the background music.
Okay, just have a look at the history then.
I think, Mahima, you go ahead with the talk. Tulika, if you can assist in getting me video, because this seems to be very interesting actually.
Okay, so that was the history, how we came to the formula feeds. So that was all about it, how the formula feed was first brought into this world. It was for the sick babies. And as time passed by, the mothers started participating in workplaces, and they started giving formula, and then it became a status symbol where everybody was into formula. And there was a stage in the late 19th and the 20th century where every mother was giving a formula feed. And in the third world country like ours, which are basically breastfed countries, it became a great pressure that all ladies, all rural women also wanted to do the same, because they thought that that was the best thing to do for the babies. So this is how it all started. And in around 1981, there were few members who realized that breastfeeding was the way to go. And that led to the formation of the International Code of Marketing Breast Milk Substitutes by the World Health Assembly. And there was a declaration in 1992, the Innocenti Declaration, which brought about the 10 steps to baby-friendly initiative, which we are still following. There have been a few changes since then, and that is what I'm going to bring about since I had to talk about the programs. So in brief, I'll just bring about a few things. So it was in 1990 that we realized that breast milk was the best, not only for the baby, but also for the mother. So all the recommendations that came and all the evidences that came along, the strategies kept on changing. And the 4 basic things that are still remaining since decades, that is early initiation of breastfeeding. Within 1 hour, exclusive breastfeeding for 6 months, complementary feeding after 6 months, and continued breastfeeding for 2 years. This is the evidence, and I think since decades we have been hearing about these 4 things, and we have still not been able to reach the goal that we have to. So all evidences are in favor that it is going to bring about changes in the infant mortality, the neonatal mortality, and evidence was like a baby who's only on breastfeeding, we can save a lot of lives. So then there were a lot of research, and there was a big agency, the Agency of the Healthcare Research Quality, where they did a meta-analysis of all the evidences that came about. And the conclusion was that breastfeeding is not only best for the baby, but it also reduces the risk of many diseases, not only in infants, but also in mothers. So what are those risks that this breastfeeding is reducing? So all these we already know that it reduces the risk of asthma, the risk of ear infections, the risk of diarrhea, and long-term effects also, like type 2 diabetes, even cancers like ALM, then necrotizing enterocolitis, and babies who are breastfed have a better IQ, and those who are not breastfed have a lower IQ as compared to babies who are breastfed. And women who don't breastfeed, they have an increased chance of different kinds of cancers and different diseases, which as obstetricians, I'm very sure that you all must be knowing. So there was a very interesting story behind it, that there was one tribe, some Asiatic tribe, where they used to canoe. They were using the canoe and they used to row the boat. And so they were breastfeeding only from one breast. And it was seen that the breast which was, they were not breastfeeding in, there were increased chances of cancers in that breast. So that is how breastfeeding is helping the mothers here. So there were various studies. Lancet came out with a very, bringing out the basic concept of the 1,000 days. So the 1,000 days is the critical window of opportunity that we are now focusing on. All our programs are focusing on the 1,000 days. Now, what are these 1,000 days? It is now said that we don't start where the baby is born. We start from the antenatal period, and we have to target at the pregnancy. And this is the time where we need your help. This is the time where all obstetricians and pediatricians have to hold hand together. So we are targeting not only infancy and childhood, we are targeting the antenatal period as well. So what is the data saying? As all the speakers who have already spoken have already brought about the dismal report card of India, that we are still ranging to at around 41 to 54% in the breastfeeding rates. So I'll just skip these slides. What is more important is how can we reduce infant mortality by this breastfeeding here? So what we see is that the neonatal mortality is basically in the preterms and low birth weight babies. And the percentage is quite high, the 15 to 20%. And it is seen babies, the preterm babies and the low birth weight babies who are put on breast milk have a higher chance of survival. So we have to act on that also. So the program that somebody had already mentioned from the esteemed faculty, the MA program, which is taking care of all the aspects of the antenatal period, the period when the baby is born, and after that also. So how are we faring? What is our report card? This is about India that we are talking about. So there's an initiative taken by the World Health Alliance where breastfeeding trends and initiative tools have been developed. And there are certain 15 indicators on which we can score a country as to how that country is faring in their feeding practices. And this is a report which came out in 2018. This is India's report. And India, as you see, has failed to make progress in the key policy and program indicators. So India has failed. Most of the colors that we see here, see the colors are green, blue, yellow, and red. And this is the best and this is the worst. So most of the color that we see here is yellow. So India has till date failed in getting to the targets that we have to achieve. So these are the indicators. I'll just take them one by one. The indicator one is the National Policy Program and Coordination. So India till date has not adopted any policy dedicated to IBS. There have been many documents, but there is no adopted policy by the government of India. So this is the time that we should take this to the government. Then the central government and the state governments need to elevate. There are no sufficient funds. Our neighboring country, Sri Lanka, they are doing so well. They have reached up to 90% in early initiation of breastfeeding. How? Because the funds allocated for these programs is much higher as compared to India. The Poshan Abhiyan that is being brought about by the government is a step in this direction. So India has scored only 1.5 out of 10 in these policy programs. The next is the BFHI, the 10 steps to successful breastfeeding. Now this is the same since 1990 and some revisions have been done in around 2016 and 2006. And these revisions are still not seen in the IECs that are being, the posters that we put up in our hospitals, in the district hospitals and all. So something has to be done about it. And there are various programs which are doing, there are steps taken in this direction like the Mother's Absolute Affection Program, the Aspirational Districts Program and the Lakshya Program. Maybe in next 3 years when we again do this activity, we might be doing well. But as of now, we are doing really badly in this direction. Then the IMS Act. We all know about the IMS Act, where we are not supposed to use any kind of milk substitutes, feeding bottles, and things like that. So we have a good law. So we have done quite well in this area, but it has decreased from 9.5 to 8.5 because the law is not enforced very well. So, and mostly it is taken up by the NGOs. We as doctors should be taking up this issue and should not propagate the usage of breast milk substitutes. So we are doing well, we can do better. So then the maternity protection. So we all know about it. We have been in the government service. We know that we have a maternity provision of maternity leave, which initially used to be only 12 weeks and it has been increased to 26 weeks. We have different programs also, but this is all in the government sector. The private sector, there is nothing for these women. Even when we think about the nursing homes or the women working in the private sector, is there a provision for a maternity leave for them? So we have to sit back and think about it. So again, we have not fared very well here, but it's not bad. We can do much better here. Then coming to the health and nutrition care system. So we have a Poshan Abhiyan. We have taken a step ahead in this direction by having health and wellness centers where we are targeting the adolescents as well. So we have scored around 50% here, and maybe in a year or two we'll be doing better. Then mother support and community outreach. Now this is the area which we as doctors can really help in, and maybe our report card would be better. It's at 60%. We'll maybe in the next few years we might reach to a better goal. Then IEC is 50% only. Infant feeding in HIV, again 60%. So a lot to do in this direction also. Then infant feeding, now there is no policy till date for feeding of infants in emergencies. Till date, there is no such law where there is a nodal person where you can talk to. Still, things are like that. Even in this corona pandemic period, a lot of dabba milk could be seen throughout the rural population because there were so many myths amongst the, even the doctors were not convinced that the baby should be breastfed. So we should have a good policy. We are really doing bad here. Then mechanisms for monitoring and evaluation. Now we have a good system for that. And so we have scored around 70% in this area and we can do better. And then other practices, the early initiation of breastfeeding, exclusive breastfeeding for the first 6 months, median duration of feeding, the bottle feeding. So all these rates, as you can see, if you can see here, 2015 early initiation was around 44%. It has dipped a bit. So we are not scoring that well here. We have to continue. So sustenance of whatever we have done, at least that we should target. जो पुराना हो चुका है उसको कम से कम continue करें. This is what our targets should be. If you look at our neighbors, they are doing quite well. Look at Sri Lanka. Look at here. See, they have reached 90%. And this is the first country which has been given the green breastfeeding, the title of the green breastfeeding. It's a small country. So we have to achieve that goal. So what are the barriers? So barriers I think we'll be discussing in one of our sessions. So I will not dwell on this slide. It's just to know that there are so many barriers in front of us. So how do we cross them? Rapidly, I would just like to bring about that the 10 steps, if those 10 steps are followed properly, that is the way to go. We as healthcare workers have to have a very good policy, and this policy should be shown everywhere in our wards. Like when we were in BRD and Dr. Reena, we used to have those IECs always displayed. So we have to have a policy, and this policy should be communicated to everyone, right from the person who's in charge to the lowest grade person, because they are the ones who are roaming about in the wards and giving their advice to them. So each and every, even the Aya working there should be conversant about how to go about with breast. Everybody should be trained and we should have a good policy. So training of healthcare staff in all the skills. Everybody has to be trained. Then inform all pregnant mothers about the benefits of breastfeeding, and we should start from the antenatal period. So like Dr. Sneha has rightly pointed out, so that is the best time. So what an obstetrician can do? Antenatal counseling. We can do an antenatal counseling. We can have a short course for the mothers. Most of the private sectors are doing that already. In big corporate hospitals, you can see that the mothers are called for prenatal counseling sessions. We can have a short certified course if both the obstetricians and the pediatricians can join hands in that and have a short course for those mothers. That would be great, because they are then prepared when they are delivering the baby. They should be told about the importance. They should be asked what could be the problems that they are going to face. And this, I think everybody is doing, looking at the nipple, whether it's an inverted nipple or not. I had a talk with the obstetricians in my hospital as well, and few other obstetricians. So this is already being done. And one more skill that we have to teach is breast milk expression, because this is the only thing that the mother that is going to help her as soon as the baby is born and she has any problem with her attachment. So we should teach this skill to the mothers. We should help mothers initiate breastfeeding within half an hour. Half an hour it should be immediate. So what can we do? What are the things that an obstetrician can do? Early skin to skin contact. Now what we have when we were doing our survey, we are already doing a survey in a whole of UP, and what we saw was the early skin-to-skin contact was almost to the range of 80% in most of the areas. But what they were doing was just bringing the baby and putting the baby on the chest, and within 1 or 2 minutes, the baby was being then removed and put in the warmer. So they counted it as skin-to-skin contact. But this is not to be done. The baby has to be left there. The breast crawl that we talk about takes around 1 to 1.5 hours. So there should be one person. So this is the time that we should have a lactation counselor who's standing there, or a staff nurse who's dedicated to doing only this job, standing with the mother, or even an attendant who's there with the mother. He can stand with the mother, because the baby is in the prone position on the chest of the mother. So there should be somebody to hold the baby there. So we have to help in that. Wait for the breast crawl. Record the time of initiation of breastfeeding. Now this data is going to really help. I'll tell you why, because then somebody becomes accountable. कि मैंने इतने बजे पिलाया, तो ये लिखने के लिए the person has to stand there and see. So once you start doing this, things are going to change. And this is the part of quality improvement. Make it a quality improvement thing. Maintenance of warm chain. Never separate the mother from the baby. And what are those things which are separating the mother from the baby? See, if you look here, the baby's cord is being cut, the baby is taken under a warmer, the cord is being cut, the baby is being clothed. So all these things are separating the baby from the mother. Jaldi kya hai ye sab karne ki? We should wait. We should keep the baby with the mother. Weigh karne mein koi jaldi nahi hai. Basan thode der baad ho jayega. Doesn't matter. Suctioning, measuring, bathing, dressing, all these things can wait. First, we have to initiate the breastfeeding. So this is how we have to follow the skin-to-skin contact. Now, new evidences have come up. Breast milk, why do we keep on saying that breast milk is the best milk? We have seen that the chances of the child having asthma or type 1 diabetes and all these things are reduced if the baby is breastfed. So now data is saying that there is a microbiome which the baby is receiving from the mother from the antenatal period. And babies who are brought out by LSCS are somehow they are not getting, because they are not getting the vaginal microbiome when they are coming out of the womb. So the best thing that we can do for those babies is give them breast so that they get that microbiome. And why is this microbiome important? Why? Because all these things, these children, if they are not put up on breast milk, they might have chances of type 1 diabetes, atopic diseases, colic, and all these things. So you always will get a colicky baby who's on top feeds. And these microbiomes also have a transgenerational effect. So it's not only one generation that we are talking about. We are talking about generations ahead. So if we breastfeed our baby, we are also taking care of our generations. So that is also that is the thing that we have to stress upon, why it is important. Then we talk about the human milk oligosaccharides. Now these are the fiber on which these bacteria are feeding upon. So if we are giving top milk, we can never replace the HMOs that are present in the human. And why are they important? Because they are protecting the baby against the pathogenic infections. They are promoting the development of intestine. So even all viruses and bacteria, they are not able to enter the intestine. So all these things. Then next is show mothers how to breastfeed and how to maintain lactation, even if they should be separated from their infants. Breastfeeding is most essential for mothers for whom it is most challenging. LSCS, maybe we can give a skin-to-skin contact right on the table where we are doing the cesarean section, and we have done it in BID. I might be having some videos, I could not find them. We have done it. And believe me, it's really nice to see obstetrician taking full part in doing it. And Dr. Reena was there, and she was the one who helped us achieve this. And I hope we are continuing Now, one thing, because the mother is with the obstetrician all the time, so we should all be aware of the LAT score. This is the score which will help us decide that at discharge, the mother is confident enough and is ready to be discharged and will breastfeed the baby long term. So this score, everybody should know about, where we see whether the latch is good, whether there is audible swallowing or not, what is the type of nipple, what is the comfort of the mother, and what is the positioning. And any score less than 7, the mother needs support, and we should be there for the mother. So that score is one thing which should be a routine. Every resident should be taught about it, and in their daily rounds, they should be seeing this score, and even at discharge, it should be mentioned in the discharge card. Give newborn infants no food or drink other than breast milk unless medically indicated. Now, this I think we should follow, because I have talked to a lot of mothers and they say कि उतरा नहीं, milk उतरा नहीं, तो हमने ऊपर का हमें पता नहीं, हमको बताया गया.
थोड़ा सा टाइम का याद दिला दो, बहुत ज़्यादा.
Okay. So a word about the breast milk, human milk banks. Okay, I will just skip all the steps and practice rooming in, allow mothers and infants to remain together for 24 hours. Then a word about the breastfeeding cues. Now this should also be taught to the mothers when the baby is hungry. You should not wait till the baby cries. This is the 3rd stage. And here the baby will not breastfeed. So they should know when the baby is ready to breastfeed. These cues are very, very important. This should be taught to the mother. I'll just skip the slides because I think give no artificial, so everybody knows about it. So what can we do at discharge? We should see whether the mother is confident.
Ma'am, we have 2 minutes left for this session. Sorry to interrupt you, ma'am.
Okay, it's finished. So what can we do as a community? As employers, we can have special space. We can give them special space. We can give them a chutti. We can ask them to work from home. We can ask them to do teleworking if required. This is the way we can help the mothers who are working. Okay, we can have newer initiatives which we can come together and get newer initiatives, community drop-in centers, online courses for parents, tele-lactation counseling services can be provided to the mothers. This is how we can support breastfeeding. We can give incentives to the breastfeeding mothers so that they keep on breastfeeding. So one of the easiest thing you can do is, instead of asking, are you going to breast or bottle feed, ask the mother, how can we help you to breastfeed? This is what we are supposed to do. So this is all about my presentation. A newborn baby has only 3 demands. They want the warmth of the mother's arms, food from her breast, and security in the knowledge of her presence. And we are the ones who are going to support the mother in doing so. Thank you so much. Thank you for giving me this opportunity to bring about these points. Thank you.
Thanks, Dr. Mahima. That was an excellent scientific deliberation. And you have rightly told about the portion of 1,000 days. That's an important Government of India initiative, and it has opened many arenas of nutrition to the mother, pre-pregnancy counseling, antenatal care for the mother, and definitely after the birth of the baby, we have to look into the nutrition of the baby through exclusive breastfeeding for initial 6 months, and then subsequently also to carry on the breastfeeding as much as possible together with the supportive treatment, supportive feeding. The concept of 6 months exclusive breastfeeding has to be really understood both by the obstetrician as well as their patients. That is why 6 months maternity leave has come into vogue, because 6 months baby does not even need water from above. They just need breast milk and breast milk and breast milk. Breast milk, as you told, is both good for the baby as well as the mother, and they have a long way in going to develop the traditional cooperation and adhesions between the mother as well as the baby. They develop a good relationship throughout, which lasts throughout the life. And we know that breast milk is the best milk, and it's the, we say it's the nature's nurture. Then Amrit hai. We have to talk about that. Thanks, Dr. Mahima. for your excellent deliberation. You have touched many points, how we can cross the barriers of breastfeeding, and breastfeeding is not a choice, it's a responsibility.
Thank you, chairpersons, and thank you, speakers, for such a wonderful deliberation. Now, I would like to invite Dr. Aruna Chaparia to conduct the second session.
Thank you, Babita. After such an excellent first session, now let's have the pleasure to enjoy our second session, Breaking Barrier to Breastfeeding. A good discussion increases the dimension of knowledge of all who takes part. And for today's discussion, we have eminent speakers, Dr. Ekika Singh, Dr. Ritu, Dr. Geeta Gupta, Dr. Sunita Kumar, Dr. Mohit Agarwal, Dr. Shaili from Noida, Dr. Shaili from Kanpur, Dr. Sangeeta, and Dr. Tulika Jahan. And to moderate this session, I welcome Dr. Sadhna Gupta ma'am. Valuables we carry may impress others, but the values in form of knowledge Dr. Sadhna Gupta holds inspires all of us. Dr. Sadhna Gupta started her academic career with gold medal, and now she is in front of us with so many credentials. Her major achievements are FOGSI representative to SAFOG, ICOG Governing Council member, corresponding Editor General Ops and Gynae India and SAFOG, Vice President FOGSI 2016, Chairperson FOGSI Safe Motherhood Committee 2011.
Aruna, I think it's enough. Aruna, it's enough. I think we can go ahead. We know each other and everybody so well. So because we are already late, so we will be going through. So let me invite the panelists and let me share the screen. Thank you very much, Aruna. And just for the sake of time, I interrupted you. It was only my introduction, but I interrupted. So we are all panelists are waiting, and I think all people who are with us on this. And stop sharing, Tulika, so that I can share the screen. Thank you, Aruna. Thank you, everybody. Once again, and I am sharing my screen. And first, yes, just stop share. But let me first, Tulika, stop share. First, you share all the CVs of all panelists, please, Tulika, before I share the screen.
Okay, ma'am.
So we have a wonderful galaxy of panelists. And what we say from the chief guest to the Dr. Mahima, they have all emphasized what is important breastfeeding, and there is no question about it. But why we have to choose the barrier and why India is not doing so well. So we have young Ekika with us. She is Secretary Mahu of Gynae Society, very, very active academician, awardee of various social awards, and she has won many, many good paper award presentation. Next, please. Ekika, welcome. Ritu Sinha, she is Secretary of Allahabad OB Gynae Society. She has been ex-treasurer, holding many posts in the Allahabad Society and editor of the Souvenir and organizing committee member of various conferences. And the very, very very active secretary of Allahabad OB Gynae Society, and she has a special interest in high-risk pregnancy and adolescent health. Our next panelist is, next please, Tulika, Dr. Geeta Gupta, our own. She has been former faculty in BRD Medical College, Gorakhpur, and a very, she is one very organizing support for our all programs in the academic program and the conference, and she has been organizing many workshops and has been actively participating. Next, please. Welcome, Geeta. Dr. Sunita Kumar is with us, and we will take you as an expert, and when will be issue, we will come to you, Dr. Sunita. She has been already introduced. She is ex-Superintendent-in-Chief District Hospital, Gorakhpur. A very senior pediatrician. Mohit, another extreme, because it is the young generation who will go ahead. He is a private practitioner and area of interest in neonatology. Welcome, Mohit. Next, please. Next. Dr. Shaili Agrawal, close old friend. She is currently professor at the OB-GYN School of Medical Science and Research, Greater Noida. And she is a alma mater from the Jhansi and has been participated in many conferences and a very well prepared person, what I say, and a very meticulous person. And her area of interest is high risk pregnancy and critical care. Next, Dr. Shaili Porush Agrawal. She is very active member of Foxy Safe Motherhood Committee, and she has been scientific secretary of WW Pond, founder member of Kanpur OB-GYN Society, and many publications to her credit, and the speaker in many conferences. Welcome, Shaili. And next, please. Next, Dr. Sangeeta Pawar. Yes, she is professor and head of the OB-GYN department at SRGD Medical College, Amritsar. She has been the supervising and co-supervising many theses, founder and president of Amritsar Menopause Society, got many prizes and 20 to 25 publications to her credit, and invited faculty and very much interested in the public health. Welcome, Dr. Sangeeta, right from the city of Golden Temple. It's a blessing to have you. And Dr. Tulika Jha, we welcome you, Dr. Tulika Jha from Kolkata. And she is member of Core Committee, High Level Task Force for Maternal Health, and she is Clinical Secretary, BOGS, Joint Organizing Secretary, upcoming AICOG 2023. She has been several publication, examiner, postgraduate, authors, and faculty. Welcome, Tulika from Kolkata. So with all, we have a real academic institution, practitioner, organizers, and so we are going to have really a good discussion, and that will be heart-to-heart discussion, because we know many things. Today's problem is that we know too much, but actually it is only action which matters in the world. So greetings again from Gorakhpur. Truth prevails always and ever. All are in search of universal truth. And that's why the cycle goes from the bottle feed industry, infant feed substitute, again to breastfeeding. I bring greetings from Foxy and welcome my all panelists. So again, what we say, our Gita says, Krishna himself emphasized the food what we eat. It can be sattvic, it can be rajas, and it can be tamas, because what we eat, we become what. And nutrition is centered around which life cycle of life being revolved. So our philosophy actually emphasizes a lot on the nutrition, and the breastfeeding is the first nutrition which a newborn, when a live being comes into, mammalian when comes into life, they have the breastfeeding. And probably the no other health behavior can affect such varied outcome in the individual who are involved, like baby, mother, family, community, society, country, and everyone. And let's discuss that where we have lost the way, and that is the thing. I think there is no difference of opinion that breastfeeding is the best. And what we say that, are you aware of our crucial role? I think all chairperson and speakers have said that. I think we all are on the same page, that we know that we have a crucial role in implementation of exclusive breastfeeding. So coming straight away to question, one thing, we will be very short in this answer. And I think Mohit, the answer to the child, what the Dr. Mahima and everybody has covered so well. So we come to you last, Ekika and Ritu. Ekika, I will have this question to you. It is child. And yesterday only in some panel, I was saying everybody is focusing on child. Does breastfeeding help the mother? Ekika, to you. And to Ritu, does it have a developed effect on environment? Because that is also very, very important. So Ekika, you say breastfeeding, how it is beneficial to mother too. Please, Ekika.
Ma'am, first of all, it's the most natural thing. So anything which is natural is going to help both the child and the mother. For the mother, breastfeeding, if I start with the simplest thing, it helps in good involution of the uterus, first and foremost. Secondly, it helps mother to, check out that extra fat also. So sometimes a mother who breastfeed her child lose weight also if she is continuously exclusively breastfeeding. This is for the physical appearance of the female who think that breastfeeding should not be good. Besides that, it does help females as a contraceptive. Most important, because many a times female come to us and they say कि madam एक साल हो गया महीना नहीं आया बच्चे को दूध पिला रहे हैं. So it helps as a contraceptive also, and then it helps to prevent a lot of cancers like breast cancers, endometrium cancers, and the other cancers in mother. So breastfeeding, and specifically exclusive breastfeeding for 6 months, not only help child, but it also is very helpful for the mother.
Thank you, Ekika. I think you have covered so well, and it is
Can
very
I add?
important.
Can
Yes,
I add,
yes.
Sadhana
Yes,
ma'am?
yes, yes, please.
I want to add, Dr. Eka, that it has got cardiovascular benefits also to the mother. And secondly, it improves insulin sensitivity, and it reduces the chances of diabetes also later in life if mother is breastfeeding exclusively for 6 months, and even she can feed up to the 2 years. So I am adding extra that cardiovascular benefits as well as benefits against the diabetes to the mother also.
Thank
Also
you,
osteoporosis.
And ma'am, one important thing which I think which you have also mentioned, that the feeling of being mother and the, you know, a contentment feeling when your child is in your arms touching you, that's that feeling is cannot be expressed in words and neither in money. So I feel this is how it helps a mother. She develops a very strong relationship with the child. The more
I would like to
I
add one thing also. It also prevents anemia, because anemia is very common in India. So by preventing the PPH and by involuting the uterus and by creating amenorrhea, it's also adding in the prevention of anemia also.
So thank you very much. Actually, what Mahima says that it is other side of the story. So we are continued with our patient post-operative. And what you say, it is prevention of cancer, it is prevention of non-communicable disease, it prevents the good weight loss, and it is one myth that it disturbs the figure, but it is not so. It is contraceptive and a contented mental health, which is one of the things. In the next part, we will say that does our society really support the mothers and everything equal. Ritu, to you, thank you very much, all the panelists, and a very good addition. And we have to emphasize in our practice that it is your all efforts are not in vain. It is also helping you also. And in PPH, really, I have seen that when the PPH and when they were not so drugs, it really the start of breastfeeding help. So Ritu, from mother to we will go to the environment actually. And Ritu, what's your say that how the bottle feeding and the infant feed substitute, how it is having a panoramic effect on environment? Ritu, to you. Ritu, and anybody wants to add. Ritu Sinha.
Breastfeeding, breastfeeding has many environmental benefits. And it is these days it is used in reducing the impact of climatic change also. That is why in 2020 they have actually the breastfeeding week theme was the support breastfeeding for the healthier planet. So breastfeeding, as it is said, it saves energy, as it is a completely sustainable source of nourishment, I should say. And so because the body itself produces it and it requires no packaging, so there is, and it is also 100% mom powered. On the other hand, the production, packaging, then distribution of the milk products that requires an overwhelming amount of energy. Secondly, it decreases the packaging waste also. So in that, I would say it also reduces the waste pollutions. Then the most common replacement of the breast milk is cow's milk. So by breastfeeding, actually, we are helping to reduce our society's dependency on the dairy farming, and thereby we preserve our forest, which might be used to fulfill the demands to raise the livestock. And it is said that it also helps in reducing the methane overload, which is an important greenhouse gas, and it causes global warming too, because it is said that 40% of the human generated methane is contributed by the cattle activity. So if we depend entirely on the breast milk, then our dependency on the cattle can be reduced. Moreover, it also saves water, because it is said that 144 gallons of water is spent on a dairy cow to produce 1 gallon of milk. So, and also when we substitute the breast milk, it also needs to be added more of water or liquid. On the other hand, a mother, what does she need? She needs only 8 to 10 glasses of water in a day. So in a way, we also save water. So this is all how it impacts the environment.
Thank you very much, Ritu, because actually we have to see in a panoramic view. It is just not a clinical issue or problem. Actually, it is an issue of our survival, and many people must not be knowing. It is only economic imperialism also. And as a South Asian region, as a developing world, we should be very much susceptible about it. We must be knowledgeable about it, that there are only 40 to 50 processing parts for the infant milk substitute in the world. And the milk from cows to factories to home, then from liquid to dry to make again liquid with use of water, fuel and load of plastic bowls. And it is a really hazardous and never ending tiring journey. So this is one aspect which we usually don't discuss in our discussions, but we should be very, very well aware, because COVID has given humanity a slap over our ways of living, and we should learn lessons from it. Before going to next question, Mohit, everybody has says that it is best, I think, it has been covered. If you want to add in 1 or 2 lines that why the mother's feed must be given to baby, whether this is this mother or in relation, please statement, give 1 or 2 sentences so that we go ahead to the point which we have not discussed in the previous. Mohit, to you.
Say that already most of the things have been covered by Dr. Mahima ma'am and everybody else. I just want to add that for the baby, it serves as a complete nutrition, and for the preterm baby it also acts as like a medicine, breast milk, and it is stopping so many diseases in the preterm baby like sepsis, NEC, feed intolerance, retinopathy, and readmission.
Yes.
So many things. So
yes, please complete. Mohit, yes.
So
yes,
there is no question that it is the best, safest, and the way to go. And it's only a matter of our commitment, that how much we can commit ourselves to it.
Thank you very much. It is matter of commitment. What you say, that is the last word, that it is our commitment, and no breast milk substitute ever made comes anywhere near the perfect natural food for that. So it is sustenance, soulless, security, sovereignty, sustainability, and pacing birth. So when we think again, we will go to Mohit with your continued question, that just say, what is the optimal breastfeeding and the optimal complementary feeding? It is to Geeta Gupta also and to Dr. Mohit Agrawal in a very brief and concisely, so that we are very clear about what is exclusive breastfeeding and what is the complementary food, when to be started. Very briefly, Geeta and Mohit both.
Optimal breastfeeding starts just after the birth, within half an hour. If we are giving breast milk to the baby and baby is fed.
So that has been covered. Actually, what is meant by exclusive breastfeeding for 6 months? Because that is the question where we are really confusing.
Exclusive breastfeeding means we are not giving any
yes.
Even water to the baby,
yes,
except medicine if required and advised by the pediatrician to the baby. Otherwise, we will only give the breast milk even in the summer when there is very dry environment, and patient think that the baby, mother thinks that the baby is thirsty and he or she needs the water. The breast milk is sufficient.
Yes, important thing is that no other food or liquid to be given when the baby is on exclusive breastfeeding. Neither water, nor honey, nor gutti, and anything. That is very important, because there is the gap. And Mohit, you will add to what Dr. Geeta has said about the complementary feeding, because as an obstetrician we must.
Night feeding is also night feeding. Most of the time the women are avoiding night feeding. Night feeding is also an essential part of it, because
yes, please go ahead.
Night feeding helps in maintenance of the breast milk.
It is exclusive and exclusive. Then Mohit, you want to add about a little bit about complementary, क्योंकि कई बार बोलते हैं अब फूड ले रहा है, बाहर का खा रहा है, तो अब ऊपर का भी दूध दे दें और ऊपर का खाना दे दें. So just make clear ourselves that what is meant by the good optimal feeding pattern for the babies.
Ma'am, complementary feeding also is very, very important, that we must also focus on complementary feeding along with breastfeeding, because what we see is that sometimes mothers are breastfeeding, but at 6 months, they are not starting the correct complementary feed for the
Yes.
baby.
Yes.
So this is very common. They are usually starting dal ka pani, or they are starting some sort of liquid, which is very watery. Now, the appropriate thing to start will be something which is soft and does not have any thing which needs to be chewed, but it has the consistency of at least like as viscous or as thick as honey. So it will be like a khichdi, a porridge, a dalia, or a
And the
suji.
breastfeeding to be continued in that
Yes, ma'am.
weaning period.
Breastfeeding
That
must be continued during
must
that
be
period.
continued
And
as
at-
long as possible. I think
as long as possible.
At least for the 2 years. At least for 2 years. And
At 6 to 7 months, at least 2 to 3 feeds of half small bowl to 1 bowl should be started. And once the baby reaches 9 to 12 months, then 1 to 2 snacks, which is actually not snacks which we think of traditionally, but it is like some fruit or some small thing, biscuit or something like that, which we can give to the baby along with 3 meals. And rest of the time, at when the baby is not supposed to be given meals, that time breastfeeding and must
yes.
be continued.
So, Shally, I think it is Shally from Noida. Though everybody has remunerated that, yes, we know all these things and we might not be knowing also some things. What are the major gross reasons? We will go into the intricacies later, but what are the major gross reasons that most of the babies are not receiving best, what Mohit and Geeta was saying, exclusive breastfeeding day and night, without water, without honey. Shally, your experience as a practitioner in the teaching institution, what's your experience that where the things get really broken, that thing? Shally from Noida.
Here I would like to divide this category into 3 segments. Those ladies who are not able to breastfeed within the 1 hour, that is the initial stages. Then those ladies who face problem at around 10 days, 12 days, 2 weeks, and those which face problem, who face problem about 4 to 5 months. So in the initial sector, what are the causes why this is not happening? If it's a vaginal delivery, patient could be exhausted, not motivated, not prepared for initiating breastfeeding. And if it's a cesarean section, could be anesthesia, anesthetic effects. Something, ma'am, which we have noticed is, though there are ward timings, but in a maternity ward, a lot of men are there. So that you don't have that protective, secure, comfortable environment. Despite our speaking all the time that men should be out, these are the visiting hours, people find it very hesitant. The women may not be able to breastfeed. And then we have those cultural and family norms. Every time on morning rounds, we would check the position once or twice, but then we would tell the sasumas and all the company people that please give her this colostrum. पहले तो मैम एक आता है आंसर कि ये तो बहुत जरा सा है, ये तो पीला पीला सा है, ये तो पस जैसा है. So the question is how to break those family myths. Some of them says ये तो cow के बछड़े को देना है, goat के बछड़े को बच्चे को देना है, ये बच्चे को नहीं देना because it will do harm.
So that is the social, but very, very important point you brought out, that the presence of always visitors, unknown visitors, men, this is very, very important. And we will go into the intricacy of this thing, and we have categorized broadly. Anything, a very broad factor, we will go Shally into the intricacy of it. That is very important point you take out. Yes, mother-in-law, I think we take it too negatively, even as a professional. They have been quite supportive as well sometimes. And we say and Shally, you please continue with this.
And the religious norms. They are.
And one is yes, social norm, and another issue, because we will come to that. Yes.
And then, ma'am, the working women, exclusive 6 months, ma'am, we can all equate. वो 5 महीने से ही शुरू हो जाता है, 6ठे महीने पे जाना है तो एक टॉप फीड दे देते हैं, रात के वक्त दे देते हैं. 6 महीने बाद जब ज्वाइन करना होगा, then baby will not be adjusted. So I feel that these are few basic things that which hinder exclusive breastfeeding.
So thank you, Shally. I think you have covered very well, and we will share something that we may people responsible for their own like issues. But actually what Dr. Mahima said, and I remember when I was joined as a resident, it was 1981 to 80, like 90, I think I can say that it was the professional and commercial influence which combined to discourage breastfeeding. We as a doctors actually changed the people's behavior because of they were supporting conferences and they were supporting what, and it even as a gynecologist we used to think that it is okay, it is the same thing, anything can happen. So gap in knowledge, spread information and communication, it is like we cannot say the people are backward because they say that it was a forward, they thought that it is a forward. Rich people get infant feeding substitute and the poor should also follow. Maternal employment outside the home custom, you have very rightly said, and the continued gap in maternity legislation. So it is not in only the people's mind, like they are responsible, but actually it is whole of the system which actually causes barrier to optimum child feeding practices, and we are also responsible for it. So this is the question to Dr. Sangeeta and Dr. Shaili Kaushik. Dr. Mahima has actually covered quite a good report card, which I was also be sharing. But I think to cover the panel, Dr. Shaili and Dr. Sangeeta, you will say very, very briefly about what is the situation in our country and your perspective, not the actual data, but what is your perspective, Shaili and Sangeeta?
Yes, ma'am. Yes, ma'am. When you given this question, I did a study, and then the National Family Health Service Survey 4. The data from that says it is around 44% in our country. But the good point is now, latestly in 2019, it has rose to 54.9% in India. But the bad part is in UP, we are going negatively. We are having the loss of 9.7%. So in UP, we are doing very bad, according to these reports. In South and in Chhattisgarh, it is very good percentage of exclusive breastfeeding. And then the breastfeeding according time, like when 1 month, it's a good percentage, but when we come to the 3 months or 5 months, it gradually declines. So this is the data from India itself.
Thank you, Shaili. And Sangeeta, you want to add? She says that
ma'am, I would like to add my own scenario that one cause of this decreased prevalence and incidence is lack of education. We used to talk about the written policies. They are not able to even read that what has been written. Then what is the fun of all these written that policies?
And one thing, Sangeeta, the another viewpoint which I listen from the people, that the educated class is the less reluctant for breastfeeding than the uneducated class.
No, ma'am, two things.
So what's your opinion about it? Yes.
Actually, ma'am, two things. One is educated, they are going to the corporate hospitals and they are more prone to the obesity and glucose intolerance, and babies are overweight. On the second side, low socioeconomic strata, they are more prone for the poor nutrition, diarrhea, and we know that infant mortality rates because of the diarrhea is very, very common. And because of the lack of the education, knowledge, and multiple births, high order births, they are reluctant to feed their babies. Because in our institute, we are catering poor to middle class people mainly.
Yes.
They are reluctant even because of the sex of the baby also. And especially in the multiple pregnancy. If they are having twins, one is male, one is female, they will not feed female. They will feed only male. And because
Thank you very much, Sangeeta, for bringing out this point. This is actually, these are the things which reflect our society's illness, that is still, this is very, very important. In twin, they will have more, like the always male child is prone to get more breastfeeding. And what you say, the extreme of literacy and extreme of richness or the poverty, that actually disturbs the breastfeeding pattern, because like everything is sickness. Anything, Sangeeta, you want
I would
to
just like to, can I add a point?
Yes,
Actually,
yes,
and
yes.
corporate hospitals hospitals are also not baby-friendly hospitals in the
Yes,
truest sense.
Yes,
They are
exactly.
not practicing rooming. Not all are practicing rooming in. Not all are practicing exclusive breastfeeding. So
yes,
the other end of the spectrum is also, they're not working
yes.
properly.
Thank you. I think it is Tulika because I'm.
Yes, I'm Tulika.
Yes, I'm
Yeah.
Tulika. Because,
Actually, ma'am,
Tulika, this is bringing. Thank you very much for bringing, because you see the Gorakhpur is doing much better, but the Delhi, I think so many relatives say that
Ma'am, even in the Lucknow,
they have separated
in
the
the
baby
Lucknow, it
and
is not.
they have
Right.
separated
They keep the
baby.
baby in an ICU for observation
Yes,
for
yes,
24
yes.
hours.
And the test meal and many things. So corporate sector, they are not at all baby friendly. And
No.
this is again, being very rich is also become, they are paying too much, but actually their mothers and children are not getting so much of good. So thank you, Tulika. Thank you, everybody for this. And what is, I think we wish to bring down the positivity in India. It is in Western world, what you say, it is much less incidence of breastfeeding. 90 to 95% of children ever breastfeed. Like they have the breastfeeding, and the demand feeding is a common practice in India. But the issue of the colostrum, pre-lacteal feed, and the exclusive one remains with us, and that we have to be careful, that we have to be intervened, but we have to be pride in this culture that majority of children are ever breastfed in our country. There is a lot of gap. Few, like there are many report cards, and the many states are having the different things. Many are actually dropping out also, and a huge interstate variation, what Shelley has pointed out. And again, we say still we are much lower in the hunger index, and the breastfeeding initiative actually will improve our status in the hunger index of the world. So it is commitment, what Mohit has already said. Now coming to with this overall panoramic view globally and the country wise, it is to Dr. Tulika and then Sangeeta Pahwa, that when do you encounter primary lactation failure or secondary lactation failure, and a very, very quick sum up that how this physiology of lactation is disturbed when we don't practice the early feeding or the repeated feeding. So Tulika, it is for your primary lactation failure. It is there anything like primary lactation failure or not? And the secondary lactation, of course, there is. So to Tulika and Sangeeta. Tulika? Hello?
Primary lactation failure is not a very common thing, because it's very rarely that from the very beginning there is no milk secretion. That is a very rare thing, except for maybe when the mother is very ill. She's in the HDU or the ICU, or she's really unwell. So in that cases, it's primary, we can call it primary lactation failure, but that is not a very common phase. And the secondary lactational phase, where actually by definition, lactation had occurred, milk secretion was there, but over the next few months, within the first 6 months, it stops, it reduces, and it stops totally. So that is secondary lactation failure. And so that what happens is that could also be due to other set of reasons. Primary lactation failure is mainly because the mother is unwell and the process has not started. And secondary lactation failure is mainly because of inadequate feeding, inadequate suckling, because it is basically a circle. The more the baby suckles, the more oxytocin and prolactin is released, and the more milk secretion goes. But if some reason breastfeeding is stopped, then this circle gets broken, and then what happens is milk secretion reduces. So we have to see that, so that this does not happen. In the primary lactation failure, many a times there's nothing much to do. We can give, when the patient gets better, we can improve the nutrition, we can give think of giving galactogogues. I don't know whether they really help or not. But in secondary lactation failure, we definitely have we can change that, because we can advise the mother, counsel the mother, so that she keeps on breastfeeding the baby regularly, and so that the secondary lactation failure doesn't occur.
Thank you, Tulika. It was quite concise and the complete. And what we say that the oxytocin is supposed to be a love hormone, and it is the interplay of oxytocin and prolactin, and how it really that interplay that it manufacture milk, and oxytocin actually secrete the milk. And when we have the like what we say, worry, stress, pain, and doubt.
Yes.
And to my clinical practice, this issue of worry, stress, pain, and doubt with the pregnancy is like on the peak. Right from the urine pregnancy test positive, when we have so much of supportive health system, people are really worried about everything, and that negative feeling, the mental health is, I think this is one of the most important, that always the mother is too much worried about baby, and that also hinders your milk reflex, and sometimes turn into the what we say IVF babies, 40-year baby. Mother who are relaxed, they have a good lactation even at age of 40, 42. But
Yes,
the
elderly
patient is
parents.
worried, they are really very sick. So as an obstetrician, like our message to all, that make everything comfortable. Don't make the pregnancy a huge issue, social media issue, taking a snap of babies, and like no, you are so much disturbed from the basic thing, that is you have to feed the baby, you have to care for the baby. So Sangeeta, you are from Amritsar, and there we have a high socioeconomic class also. So what's your takeaway about the mother's attitude toward the, like it is worry, stress, pain, doubt, or it is a confidence, and the mothers are, women are naturally mothers. What is your opinion, and what is your like this thing?
So Dr. Tulika has nicely explained that premature babies, and if mother is sick and improper suckling and improper or absent even breastfeeding in the elderly primaries, and because nowadays in the as socioeconomic strata is becoming high and females are more towards working, they are getting married late and getting babies late. So elderly primary is also one of the cause of the failing lactation. And anxiety and depression in puerperium is also, they are reluctant for the breastfeeding. And endogenous suppression, like we are using the ergot alkaloids, they are also causing a suppression of the prolactin.
Great.
Even
Thank you very much for it. Yes.
And
So thank
also
you.
the social impact.
Yes.
So we have to assure the patient, make her comfortable, make her happy, and give her proper hydration, nutrition, and encourage her for breastfeeding during last trimester of the pregnancy, and take care of the breast to take care of all the ailments of the breast.
Thank you very much. I think which point I wanted to take, that the positive status of mind is very, very important, and that should result into the positive environment. I think the antenatal preparation, Dr. Mahima has already said that what she expects from all of us, an obstetrician, even Dr. Ekika and Ritu, your practical way, that what you are doing, don't say like we have covered all things what should be done. And in the panel, we say what we are doing and what is your experience in really doing that, so that we can be benefit. So Ekika and Ritu, Ekika, you are in Mau, like it is, we can say, our semi-rural population, and Ritu,
Yes.
what's your, Ritu, like Allahabad supposed to be always like a very well-educated people. So what's your experience? How do you, like what you do? You advise your sisters to do antenatal counseling, or you do what you do really in the
Actually,
ma'am.
yes, actually, ma'am, it is very important for us to examine the pregnant women's breast and also the nipple during the antenatal period. And we should always, yes, and we should always note down if we find anything important. By doing this, we can identify the women who are at risk of having problem later on after giving childbirth. So we can recognize the breast hypoplasia or any issues with the breast, like the normal changes which usually has to happen are not happening. And we can also see if the lady has had previous breast surgery, or if she has had some implant, like, or she may have some scarring on the breast, or the or some previous burn. And that has to be, yes,
like
that has to be noted.
Mentally
Yes.
prepared
And the
for
other,
the lactation. Yes.
yeah, actually, and also we have to identify the other high risk women. To me, primary gravida is always a high risk patient, because she doesn't have any experience of prior breastfeeding. She might know the I think the theoretical aspect of the breastfeeding, but the technicalities, the technical point, the practical tip, we have to just tell her. Then we also come across some women who have tried earlier during their previous childbirth, that they have tried exclusively, but they were not able to breastfeed their child exclusively for 6 months and all. And there are some women who have never tried in the past because they have some issues in the past. So adequate counseling, I think, and support is very necessary to emphasize these women the importance of the exclusive breastfeeding. And we can at the same time, we can,
one thing, yes, please go ahead. Yes.
We can also tell them about the nutrition they should take antenally as well as after delivery, so that they can have a better milk letdown.
So with this, all this, like we are having so much of gynae, obstetrics, and like
yes, ma'am. In our hospital,
I want to add on as
really we have we have the time, or it is not the time to think.
No time.
We take the help of our sister or make some like appointment like lactational counselor, because why there is a real gap, why there is a real no proven statistically improvement, and while the other countries, even Bangladesh and Sri Lanka is doing. So because that gap has to be fulfilled at some practical point. And if we allot one sister that you take care, that you say 4 or 5 patients waiting in the antenatal period, that you have to feed. So what's your opinion about it?
I want to tell you, yeah, ma'am, as you rightly said, it's more of a sub-urban area where I practice. Ma'am, 2 things I want to talk about. As far as breastfeeding notion is concerned, in our OPD, in my OPD, I have seen it is there in females. Either they are primary or it is the second baby or the third baby. The problem is that they don't know the importance of exclusive breastfeeding.
Yes.
They would say that they are feeding their child. Sometimes they come when the child is even 2.5 years. They say, ma'am, ek baar to doodh mein pila deti. But when you ask them, ki aapne 6 mahine, did you give an exclusive breastfeed? They will not say yes. The first thing is that, for according to them, whatever feed they are giving to their child is not adequate. बच्चा रोता है, मैडम हमको लगता है हमारा दूध पूरा नहीं है, तो हम ऊपर से बाहर से दूध उसको देना शुरू कर देते हैं. So this myth has to be cleared. It's not when you start, it is when you start, you don't have to stop for 6 months. Second problem which they come, which I would like to ask even Dr. Mohit, many a times they tell us कि madam, we went to a pediatrician, उसने बोला कि माँ के दूध से गैस बन रहा है, पेट वो हो रहा है, तो ये दूध बंद करके
formula. Come to that point, because we have said that at some moment of time, it was intended by healthcare providers that you use infant milk substitute.
Yes,
so
infant
we
milk
will come to that. We are coming just for
this is, and then the rest of the things, and ma'am, the changes which they go through. Specifically, she's primary, as Dr. Ritu said, ma'am. Specifically when they get the enlargement of breast, that Montefiore pupil, and sometimes they get a lot of itching.
You have already said retracted.
I want to add.
How you read? Yes, please.
Ma'am, right. Frankly speaking, we are not able to counsel because of
exactly. That's the large numbers of the patients.
So, ma'am,
the main thing is that we just can tell them ki ye khao, wo khao, but yes, this kind, when you can properly sit and do, because in my place, I know they know about breastfeeding, but the thing which they lack is that what is exclusive breastfeeding.
This is the time, because if we really want to improve, then we have to task shift and task share. Empower our staff, our everything, so that every person in hospital is saying only one thing, and that is so we have to be realistic. Actually, मेरा यही aim है कि हम should or do में बिल्कुल अंतर को खत्म करें. So I think one thing
I want to add, ma'am.
Yes.
So, ma'am, what we have done in our OPDs is, right in front of OPD in the same block, we are having a room where we have a family planning counselor and we have a lactation counselor. So we do send those patients even in our antenatal period for both the things, for family planning.
Yes.
And now we are planning with the Department of Pediatrics that in our waiting room, we'll have a small video displayed with a light notes regarding breastfeeding promotion. What it does, so that all the who are working who are waiting in that area can at least have a look, not just the ladies, their husbands, their relatives who are accompanied. So they can also have the feel and they can come to know the importance, because we are not doing that bit.
Thank you, Shelly, for bringing out. Actually, we need innovative ways. We
Ideas.
cannot
Yes.
celebrate breastfeeding week every year, and we are simply sticking to the same.
Actually, in
thing.
our
Actually,
In our
we have to
hospital,
innovate. Yes,
in our
Sangeeta,
hospital,
yes, please, we really want to have your.
Actually, in our OPD, we have prepared pamphlets in that our language, that is Punjabi, and in English also. And videos we are displaying, and that videos have been prepared ourselves. Our PGs, postgraduate students, are consultants, and they are displayed at regular intervals. And that is doing wonders, because in 150 to 200 antenatal patients, we are not having enough time to consult them. So that when
that's it, yes.
Then husband is sitting there and so many people are sitting there, they can see the pamphlets and they can also see the videos.
So thank you very
Ma'am,
much.
they can be given a pamphlet or something in your antenatal card, some pamphlet or something in their own colloquial language, and they can be asked while giving it to them कि इसको जरूर पढ़ना ये आपके लिए जरूरी है, इसका ध्यान रखना, कुछ समझ में ना आए तो next visit में पूछ लेना. These are the small things in the rush.
They are really noting down all the experiences at every time. Shelly, Tulika, Sangeeta, Ekika, thank you very much, because we need these innovative ideas and not only the slogans or something really practical approach to reach the people. I think very quickly, Ritu, you have talked a lot about retracted nipple. When you find retracted nipple, what do you do? It is really pathological that much. And how do you deal very quickly and very precisely in 1 or 2 sentences? Inverted nipple, how, Ritu, you deal with it? Yes.
Actually, whenever I encounter a patient with a retracted nipple, I always ask her to just manually apply some emollient on it and keep expressing it manually out. And I advise her to breastfeed regularly, not intermittently at irregular interval. That is all. And I will definitely like to explain her about the good latch. If good latch is possible, then she won't be having any problem in breastfeeding.
So that is the point. Actually, flat nipple, big breast, small breast, they really don't interfere much in lactation because the latch is on the areola, not on the nipple. And usually, if you just squeeze, it gets everted, and a flat or normal nipple usually protrude. Or very, very rarely we need something fringe-like active substance like we use, but usually not. So this is very, very important. I think everybody has covered Geeta and Tulika. I think we can like go ahead without this question that earliest, because breast crawl and the early colostrum, everything.
I wanted to emphasize on the early initiation of breastfeeding, because early initiation of breastfeeding helps in continuing breastfeeding also. And it also helps in the duration of milk secretion. So early initiation, that is initiation within 1 hour of birth, is very important. In our hospital, we usually try in vaginal delivery. It is, I would say, in 80% of the deliveries, it is done, except maybe the patient is uncomfortable or is bleeding a bit. So in those cases, other than those, and we also have a breastfeeding corner where suppose the episiotomy has been repaired and the patient goes down that bed, is shifted to that bed, and there also she breastfeeds. So within 1 hour in vaginal delivery is done quite frequently. But cesarean section, since the rates are also increasing, early initiation of breastfeeding in cesarean section has become a problem. But we are also trying to do that on table, starting breastfeeding on the table. So early initiation is also important to continue breastfeeding for 6
Very, very important. Actually, it is one of the crucial things, because earliest actually causes, it result into successful implementation. And I think we are all in the same page, but that breast crowding, skin to skin touch, I think there is a lot of gap, because what Mahima was saying, that getting patient babies in the warmer and looking for, and actually what is my experience, that like not only because there is so much pressure on giving optimal, like there should be kuch ho to nahi jayega bachche ko, kuch ho to nahi jayega. That's why the pediatrician for all pregnancy, they want to see ki age bachche ne inhale to nahi kar liya, and that makes us defensive, and we are not that assertive in doing like what is skin to skin contact, because this is the statement from a recent paper that we know that within earliest feeding is crucial, it is very important, but the existing postpartum care policies and practices does not reflect need of mother and infant. And again, the antenatal preparation, that is also important because mother is ready for the earliest initiation. So Mohit, to you, what is proper positioning and latching? क्योंकि वो क्या रहा, बच्चे को बस पकड़ा के सिस्टर चली गई और मदर, बेबी इज हंग्री, ही इज इरिटेबल, मदर इज इरिटेबल, कुछ नहीं हो रहा है, एंड दैट इज द स्टार्ट ऑफ इन्फेंट फीडिंग सब्स्टिट्यूट. बेबी ने यूरिन नहीं किया तो कौन रात में झंझट ले. So Mohit, very brief, very concise, what is proper positioning and the latching and why it is so important? Mohit, and then Shali.
Position involves position of the mother and position of the baby. So the position of the mother she can either be sitting or reclining, but she should not be leaning over the baby, and her back should be rested. And position of the baby should be such that baby's head and neck are in one line, and both are well supported, not just the head. And baby is turned towards the mother so that their abdomen may be touching. And then baby's mouth is at the level of the mother's breast or mother's nipple. And now when both are in correct position, then once the baby's cheek and area around the mouth is touching the breast, baby will root for the nipple.
अब मोहित ये इतनी बात बता रहे हैं ना, मुझे ही बहुत कठिन लग रहा है. तो प्रॉब्लम इज दिस, बहुत कठिन लग रहा है, बहुत ज्यादा लग रहा है, इतना बड़ा कॉम्प्लेक्स चीज है, से तो अच्छा है कुछ और ही कर लेना अच्छा है. So Mohit, what you say, and Shali from Noida, because Shali, how इतना कठिन चीज, इतना ये, और ये पेशेंट का सीजर भी हो रहा है, सिस्टर भी है, 4 पेशेंट बुला रहे हैं, you know पेशेंट आर सो आजकल एकदम ऊपर रहते हैं. How we can like again make this situation, like how we can train the mother very easily, and they are not dependent on us, and after second or third day they are comfortably having a good latch. Shally, your opinion? So Mohit ने तो कह दिया, अब हम लोगों की सिस्टर हम लोग करा रहे हैं.
Yes, the baby is given a green chit by the pediatricians. Then immediately in our PNC ward, what we are doing is, woman is there, we never keep the lady flat. We are keeping her in a reclined position, thoda sa ek head and raise rakh ke, and we put the baby naked on the mother's breast. And because we don't have so many ayahs with us or so many nursing staff who would be taking care of each and every patient, so we always keep the relative, whosoever relative is there by the side of the mother, just telling them to be roomed in this way only, and just to make sure that the baby doesn't fall off, because the baby is in the prone position. So we aim at training. Of course, the entire maternity unit is trained by our pediatricians. They take frequent classes, and we train the attendants in the
yes,
that's what we are doing, because everywhere we cannot give one sister for every patient.
Yes. So Shally, very thank you for being realistic as well as giving innovative ideas.
Even patient can give in the sitting position, and she should be comfortable, and she can keep one pillow on her lap, and she should not bend on the baby, and nipple and areola both should be inside the mouth. Not only the nipple and areola both.
Yes. Position we find actually problem is with the like patient को एक बार बताया, 2 बार बताया. Actually for first 2 days you have to give, and what I am emphasizing is because lack of skill support, less traditional help, community support, which is still even rare in now, even in a rural community, even in joint family. कोई काम नहीं करना चाहता, they will come and they will go. Doctors, nurses, midwives who are not trained to help, because it is a natural, but it is an art which needs a scientific approach, proper way, and it is not so easily comes to neither patient nor the paramedicals. So the training issues again comes, and we have to task shifting and task sharing. And again to Tulika, and I will say Shally Porish also, Sangeeta has contributed a lot. That how do you think that how important it is to have a yearly or 6 monthly training? जैसे आप लोग ये हम लोग मान्यता का कराते हैं, PPH ट्रेनिंग कराते हैं, ड्रिल कराते हैं, वो भी कितना होता है? But in lactation, does it really worth investment, Shally and Tulika?
Yes, ma'am. This is really worth investing, because the training of the staff is very important because हम लोग डॉक्टर सारा दिन नहीं रह सकते. It is the staff which is there around the clock and they are shifting, they're changing in their shifts. So every 6 months, or I would say every 3 months, we have to do these courses in which we have to teach them how they can counsel the patient for the correct positioning in a simple language.
Yes.
There are the charts, there are the videos which we can display. And the simple thing, जैसे अभी डॉक्टर मोहित बता रहे थे पोजीशन कैसे रखें, तो मैं बताती हूँ हमें बस 4 सा याद करने हैं. बच्चे को सीधा रखना है, उसका कंधा, उसका सर, उसके बटक एक सीध में रहने चाहिए. बच्चे को माँ के समीप रखना है, बच्चे को सहारा देना है और सीधा समीप सहारा सामने. बच्चे का जो फेस होता है, तो ये बहुत सिंपल लैंग्वेज में बताते हैं मैम, तो बहुत अच्छे से याद करते हैं वो लोग. और फिर वो लैचिंग के पॉइंट 4 पॉइंट उनको बताते हैं, तो वो समझाते हैं उस चीज को. तो ये बहुत ही फ्रेंडली लैंग्वेज में होना चाहिए इस चीजों को ना, तो कोई कॉम्प्लिकेटेड नहीं कि एरियोला का इतना पार्ट अंदर, इतना पार्ट बाहर.
यस,
दिस इज वेरी इंपॉर्टेंट.
क्योंकि उससे आदमी बहुत कंफ्यूज और डर जाता है. जैसे कोई
बहुत डर जाता है,
कठिन फील्ड में जाता है और सडनली वी आर अफ्रेड ऑफ एवरीथिंग. मदर इज आल्सो अफ्रेड. तो सीधा समीप, ये बहुत अच्छा, सीधा समीप सहारा
बहुत अच्छा था.
वेरी नाइस, वेरी नाइस. को भी हम उसी तरह से 3-4 चीजें बताएं. और जब हम राउंड पे जाते हैं, व्हेन आई सी द बेबी फीडिंग, और उसका सिर्फ एरियोला प्रॉपर पोजीशनिंग नहीं, ठीक किस सिस्टर ने बताया, ऑलवेज इंक्वायर किस सिस्टर ने बताया, देन आई रियली गो एंड से अगेन आई रिपीट कि आपको ऐसे बताना है, ऐसे नहीं बताना. बिकॉज इट इज अगेन, इट इज एन art, but art is what it is a actually science which has been expertized, then it becomes art. So we cannot do it alone. Let's say all the, हम लोगों के ऊपर सारा बोझ है, सबको नहीं करना. We have to share responsibilities. क्या है ना, ऑब्स्गाइनी के संग मुझे बहुत सहानुभूति होने लगी है, क्योंकि एनसीडी से लेके हर जना, पीडियाट्रिशियन, everybody is on obstetrician कि हमारी जिम्मेदारी है. But we have to go for the task shifting and task sharing, empower them to the others and give responsibility to the duties. So again, it is quality training, improved supervision.
And हम एक चीज और, जो अच्छा काम करता है उसका encouragement करना चाहिए.
Yes, they should be felicitated. And this is the success stories of Lalitpur कि सिर्फ उन्होंने no trained staff, it is just the girls and the women of the rural area who has been trained, and that is the Lalitpur, which is a Jhansi, which is a little backward area of the Uttar Pradesh, and they have got the so much of result. So community never like doubt कि अरे इनकी बुद्धि नहीं है. This is very very common backdoor, some resistance in our mind कि educated जो नहीं होता उसको बुद्धि नहीं होती. I found them totally intelligent, totally receptive to the doctor's advice, but we have to have that communication, and not only us, our sisters and guys, everybody should be respectful to their needs and the training issue. So coming to, very well done all the panelists. I'm really happy to have so much of innovative idea, and I'm going to write down everything. So
और हम
clinic,
yes. हम लोग भी एक काम कर, हम लोग वो ब्रेस्ट फीडिंग वीक में तो होता ही है, और एक और बार इन 6 months डाउन द लाइन अक्सर ब्रेस्ट फीडिंग क्विज करते हैं जिसमें सिस्टर्स पार्टिसिपेट करती हैं. और एक और होता है फॉर जो ग्रुप डी स्टाफ होते हैं, जो अटेंडेंट्स होते हैं वार्ड के, और उसमें भी सिस्टर्स लोग, इंचार्ज सिस्टर्स लोग थोड़ा ऑब्जर्व करती हैं, तो उसमें ब्रेस्ट फीडिंग चैंपियन या इस तरह का कुछ प्राइज छोटा जो हम लोग करते हैं फॉर एनकरेजमेंट.
पोस्टर कंपटीशन on breastfeeding of the MBBS students, and we have just that they have done wonders, that they prepared it so nicely that it was evident from far distance that they have cut the bottles, they have cut the medical stores, dabbas, and they have prepared the babies, and father is accompanying, and other persons are also getting very nice posters MBBS students have prepared. And we can prepare that posters for the.
Thank you very much. Actually, these activities sensitize them, but I am also a little bit skeptical about it, because actually, again, what we say, जो हम जानते हैं वो हमारी जिंदगी में दिखना चाहिए. क्योंकि people may be very good in MCQ, but not at all a comfortable, sympathetic physician. So that is very important, क्योंकि कई बार लोग competition, like it is good to felicitate, but they should be like practical round. What we say, Sangeeta, give the MBBS round, practical round, and problems, so that they will come to know how people behave, how they question and how we have to be patient in answering their queries and questions. So sometimes this awards things also is something become a problem also. But yes, of course.
No, ma'am, we have given award to all the students. We have given award to all the students.
No, this is just my way. What I'm seeing the world now, what I'm seeing the world, because the practical rounds in the postnatal world. So coming to the postnatal situation, we have only we will sum up in 10 to 12 minutes that what some panelists say, very, very important message that 42% of mother, I think Ekita said this thing on Ritu, 42% of mother indicated that at some point of time, doctors have advised them to squeeze urine. So indicating void knowledge gap among the, because doctors are saying. So causes of why they leave exclusive breastfeeding, low birth weight, sickness, busy lifestyle, lack of family support, lack of privacy, anxiety, maternal stress, encouragement, and so many breast problems. So again, we will say these are all queries, I think, because these have been covered. So we will give quickly that having to breastfeed at public places, this is very important, and fear that baby is not getting this thing. And the bottle feeding. One thing we will like to have, this question was to, I think, neonatal failure was to, again, neonatal. I will come to Mohit also. That somebody said, pediatrician said that this thing, and the patient comes to you. So what's your way that bottle feeding? कोई कहता है रात में एक बार bottle पिला देते हैं, बाकी ठीक है. So what's your takeaway about the bottle feeding in our area and in your experience? क्यों लोग चले जाते हैं bottle feeding की तरफ? Mohit, to you, Mohit.
What I feel is that most of the time people tend to bend towards bottle feeding. Because they feel that one, their milk is not enough, and secondly, they are probably too lazy to feed in the night, and it is much easier to just prepare the feeding formula and just feed from the bottle. But it is very, very harmful because nighttime feeding initiates the prolactin and the oxytocin reflex, and the whole cycle of the reflex breaks, and eventually it can lead to lactation failure.
ये आप इतना कठिन बात पेशेंट को कैसे बताते हो? प्रोलैक्टिन, ऑक्सीटोसिन, उसको क्या पता? वो तो सोना चाहती है ना, उसकी नींद डिस्टर्ब होती है.
Exactly, मैम, वो इसीलिए पिलाती है because that feed stays for a longer time.
हाँ, हैवी होता है ना, वो सुबह जगता है बच्चा.
उसको 3 घंटे 4 घंटे तक
समझ में आता है.
मैं एक रात में फीड पिलाती थी कि मैं 3-4 घंटा सो सकूं.
हाँ, मदर्स की कंप्लेन रहती है कि मैम ये तो पीता ही रहता है, रात भर बैठे रहना पड़ता है, और इसका पेट नहीं भरता है, स्पेशली वंस द बेबी इज ग्रोइंग एंड बेबी इज 3 months 4 months.
तो कैसे आप उसको संभालते हो? यही तो बात बोल मैं, आपका क्या एक्सपीरियंस है, कैसे आप इस प्रॉब्लम को, बिकॉज़ दिस इज द गैप इन एक्सक्लूसिव ब्रेस्टफीडिंग. यस,
इसको वंस अगेन वी हैव टू रीअश्योर, उसको रीअश्योर करते हैं मैम, फिर से उनको समझाते हैं कि नहीं, आपका फीड सफिशिएंट है और ऑप्टिमल. फिर उसको वेट गेन का चार्ट भी दिखाते हैं मैम, कि उसका वेट कैसे गेन हो रहा है बेबी का. तो जब उसको हम वेट गेन का चार्ट दिखाते हैं, तब उसे समझ में आता है कि अच्छा, ये वेट तो मदर मिल्क से ही हो रहा है, अदरवाइज तो और कुछ दिया नहीं जा रहा है. तो उसके यूरिन आउटपुट को
कॉन्फिडेंस बढ़ाइए, क्योंकि मदर के ऊपर ना बहुत ज्यादा प्रेशर मत डालिए. वो बहुत ऑलरेडी ओवरवर्क्ड होती है, ओवर स्ट्रेस होती है. और दूसरी चीज मेरे ख्याल से जो एक तो
वन पॉइंट आई वांट टू ऐड, मैम, वन पॉइंट आई वांट टू ऐड, मैम, यहाँ पर फैमिली सपोर्ट बहुत इंपॉर्टेंट होता है. मदर इज ट्राइली एक्सक्लूसिव ब्रेस्ट फीडिंग. कई बच्चे होते हैं जो मैम रात भर जागते हैं. So if she is awake with the child whole night, सुबह उठ को उसको सारे घर के काम करने हैं. Nobody is ready to understand the fact that she is awake the whole night. So the family has to understand that because of a child, and she has to exclusively breastfeed her, she is awake the whole night. So when the child is sleeping, she should get a chance to sleep, to recuperate. तो ये सब चीजें जब नहीं रहती तो दिमाग में आता है यार थोड़े समय के लिए कुछ दे दो, so that हमें भी आराम मिल जाए, कल सुबह हमें बाकी काम करना है. So family support this is very
much for it, क्योंकि हमारे यहाँ ना माता को सब लोग दुर्गा माता समझे रहते हैं.
हाँ बिल्कुल मैम, 24/7 काम करना है, बच्चा को चाहिए.
हाँ, वो पालना तुम्हारा काम है. And pediatrician too. Sometimes I really had a fight with B.V. Gupta and K.P. Kushwaha that yes, you should be sympathetic with mother, and it is a family responsibility. What is the theme of this year? That they should help in her out in the baby upbringing, and maybe husband, maybe domestic assistance, whatever it is. But actually, this is the real issues, and as a obstetrician, they are friendly with us. They share their problem, and we as a pediatrician with the forum of Foxy chapters and the ISOPAR chapter, we have to work out on this. And Shelly and Sangeeta, Tulika, you are doing so much innovative thing. Think about it, that these are the role plays, these are the case situation, and how you will deal it. We will have the next time role plays about it, and we will see that how able we are to deal with the situation.
Something I want to tell you,
Definitely, ma'am, definitely.
The pediatric department over in our place is doing it, especially for low birth weight babies, because you want to give the kangaroo care, and the mother is already exhausted after delivery. So they keep the husbands, the fathers there. Right now, I'm having one patient, birth weight is 1.4 kgs, though this patient is out of choreo and is running with fever. So she is not doing the kangaroo care, but for 17 hours, the father is doing the kangaroo care.
Thank you very much. इसके mother father सबका बराबर ही होता है ना, चाची मामी सबका होता है, तो why only mother? Thank you very much for it.
साधना मैम
यूपी में थोड़ा मुश्किल है.
साधना मैम एक क्वेश्चन है.
हाँ
कि हम लोग इसको बॉटल फीडिंग क्यों बोलते, टॉप फीडिंग बोलना चाहिए. अगर कोई मदर अपना मिल्क एक्सप्रेस करके बॉटल से दे रही है तो दैट आल्सो इज बॉटल फीडिंग. तो वी शुड कॉल इट टॉप फीडिंग.
अरुणा, हम इस क्वेश्चन को लेंगे.
Ma'am, it is given by bottle. Even if it is the breast milk, it is bottle feeding. Even
actually,
she
आजकल
breast
तो
milk by the bottle, it is bottle feeding.
आजकल तो बॉटल फीडिंग नहीं करते, आजकल तो कटोरी चम्मच.
It is not advisable.
आजकल कटोरी चम्मच
Even
होता है.
katori chammach, yes. Yes, ma'am, I want to share. Yesterday, my sister's daughter-in-law, she has underwent cesarean section, and I'm struggling since 2 days, and she has just now started breastfeeding. She is saying, I am having so much pain at the cesarean side, and I have given 3 times overrun yesterday and today also, and now she has started after 48 hours breastfeeding, and we are giving with chammach and katori, and breast milk is expressing, and
बॉटल से अरुणा नहीं देना होता है, या कटोरी चम्मच से, क्योंकि बॉटल से निपल कंफ्यूजन होता है. एंड देन बॉटल फीडिंग इज एन इजी फीडिंग. और
वर्किंग मदर है वो अपना ब्रेस्ट मिल्क स्टोर करके जा रही है.
कटोरी चम्मच बिकॉज बेबी विल रिफ्यूज द ब्रेस्ट फीडिंग.
निपल कंफ्यूजन हो जाएगा बच्चे को.
बेबी विल रिफ्यूज द ब्रेस्ट फीडिंग. एक्चुअली बेबी डजंट वांट एनी दैट.
Even the caregiver has to be trained on this cup feeding or katori chammach feeding. The caregiver जो भी उसको बच्चे
very quick round, rapid fire round about all the issues. Shelly, to you, Shelly from Kanpur and God's breast, Shelly from Noida for cracked and sore nipple, and Geeta for mastitis and abscess. And God's breast, a very quick 2-line message. And
yes, breast, we have to ask her to continue the breastfeeding and express the breast milk. And we have to tell her how to express the breast milk from periphery to center, so that it will be easy for her. And we can always advise for the warm compressors and cold compressors to soothe the breast.
So warm compressor to initiate breastfeeding, and after feeding it is a cold compression. Am I right? So
Yes.
there is no issue, no antibiotic is needed for engorgement.
No, it's a physiological condition.
Expression and expression. So this is express milk. What this is, there's a light breast massage, warm water, and then cold pack. Shelly from Noida and Geeta, it is for the sore nipple. Patient 10 दिन के बाद आपके आ रहे हैं, और Shelly has got a very good postnatal OPD also, और इस मतलब I am not able to bear that pain. So how do you counsel, or how your postnatal staff counsel about the sore nipple? And don't stop breastfeeding because of pain. Shelly and Geeta, yes.
We always ask the lady before we begin with the treatment bit. We ask the lady to show how she is breastfeeding on the other breast, just because what's the cause of sore nipple is usually the nipple latch.
Yes.
Overlatch.
The most, it is not infection, it is an improper latch. That is the one thing which we have to say. And Shelly, please go ahead, and then Geeta.
So that's why we ask her from the unaffected side, if it's there, just to show how she tries to breastfeed her lady. We can pick up the mistake, and then we can counsel her that way. And as far as the sore nipple is concerned, we have emollients that we can advise to heal that cracked nipple or to heal that sore nipple, but still to tell her to express the milk from the affected side. It's not that she will not affect, otherwise she'll land in a breast engorgement.
Geeta,
And the best emollient is breast milk itself.
Which is best emollient?
And the breast milk is the best emollient.
And that is the
Hind milk.
hind
It is
milk.
the hind
It is
milk.
rich of fat.
Which is
Because
rich
you
in
have
fat,
to
yes.
remove the ointment and you don't know what is it there. It is packed somewhere else. We don't know about its content. So one is the after milk is the best.
After milk, we have to apply over the breast.
That is very, very
And
important.
proper attachment is necessary.
And the one thing is despite proper leisure, second thing is, which is important thing I want to communicate is the frequent washing and nipple and areola with soap and water. जो हम लोगों के health worker
This is not the good thing. This should be avoided. This should be avoided.
So washing is not at all needed. It is a simple breastfeeding. Simple because what my mother doing, वो सारा जो probiotic, prebiotic, its mothers is always nice. So no washing is needed. Thrush infection, very, very quick. I think this question is for very quick. I think Tulika and Ritu. Thrush infection in mother's breast and the babies also. So how do you treat? Simple, because everybody want the medicine, like want to know how you treat. Tulika?
Yes, first of all, I make it sure that whether it is only on the breast or it's also in the baby's mouth.
Yes,
and if it's only on the nipple, then I apply antifungal ointment and ask her to keep it clean, obviously. And if it's also there in the baby's mouth, then a candid paint, mouth paint can be applied. And
this is something I have got from the gential violet, which I am really concerned that today we use, and the oral fluconazole, which I really don't think, I don't use usually in the lactating mother. So Tulika, what's your say about this thing which I have recovered from some internet information for
Actually, ma'am, previously also for
the
gential violet, GB paint was used.
Yes,
and
but
oral
not now.
discoloration, that's why we have stopped.
Yes, and oral fluconazole for the thrush infection or the local nystatin or the antifungal is okay. What's your say about Tulika for it?
Yeah, we have Mr. Gentian violet is not used nowadays. So candid mouth paint which contains clotrimazole is available. So that is typically for the mouth of the baby if the thrush is there, and for the mother we can apply any clotrimazole containing, or maybe if it does not work, luliconazole containing ointment or gel or something.
Now the last thing which really result into some very disturbing situation, Ekika, to you for the mastitis and Sangeeta for the abscess. Very brief and very quick. Mastitis, how you deal with it? Ekika and Sangeeta for the abscess. Ekika, please.
Ekika has left. She has rushed to emergency. She has left a message.
So then, Sangeeta, you can take both. And the Geeta Gupta. Geeta has been a little quiet. Yes, Geeta, mastitis. Yes.
Ma'am, mastitis is the infection when some of the ductus is obstructed in the one of the nipple. We have to, in this, the patient have pain and fever. We have to give antipyretic and antibiotics. If it is not treated at mastitis stage, then it will go to the abscess. And even in the mastitis, giving antibiotic and continuing breastfeeding is essential.
Thank you very much. It was totally complete antibiotic, anti-inflammatory support, and continue what we are together today. Continue breastfeeding on unaffected side and manual expression always every 2 hours.
Even on the affected side, we can continue. Even on the affected side, we can continue.
Even in affected, and not to what antibiotic not to give in that period. No tetracycline, no ofloxacin, chloroquinolones, and chloramphenicol. This is very important thing.
Basically, staphylococcus fluoxacillin is the drug of choice.
Yes. Dicloxacillin is the drug of choice, and then the third generation cephalosporin. So that we be careful, because otherwise breastfeeding to ho raha hai, but otherwise we give the indirect damage to the baby. And treat nipple trauma and drink extra, what is supportive care. Abscess, Sangeeta, आजकल बहुत बहस चल रही है IND versus aspiration. So
nowadays we are coming with the ultrasound guided aspiration under local anesthesia. It's not like surgical drainage. IND is not done nowadays. We used to go for the ultrasound guided aspiration.
I think once or it is repeated. What is your experience? It is once it is fine, or woman has to.
No, we have to go for the repeated also. We have to go for the repeated if it is healing again, and sometimes if it is not corrected the INDs also, that we can
Yes.
go for that.
Thank you
And
very
it
much,
promotes
Sangeeta,
the,
because thank you very much, because as a surgeon we have to be always flexible about it. Patient
Yes,
रूरल में आप उसको 4 बार बनाएंगे, वो आपसे नाराज हो रही है. If the patient is not compliant, if the patient is very abscesses, like you say that it is not going to cover and I have to call so many times, IND is okay. Otherwise, ultrasound high resolution linear probe हुआ तो बहुत अच्छा है. Otherwise, आप simple ultrasound से भी देख सकते हैं. You can locate pus and you can put a 18 gauge needle and the pus comes out thoroughly, and in 2 or 3, even if it is a small amount of pus, it really works very, very well and avoids a lot of trauma, surgical trauma, and the chances to discontinue breastfeeding. Even when you are doing
even 1 to 2 centimeter incision over on the affected side or most dominant side is also helpful. And in that, if we leave the nipple, mother can fed from the breastfeed from that side also. I have 2 cases.
Little bit difference of opinion, Geeta. If we are doing,
I have 3-4 cases. I have 3-4 cases in which I have continued breastfeeding and given the incision and drainage because the pus size was very, very large.
Breastfeeding should be continued in all cases, and that is the thing, like we have to really motivate at this point of time that you have to continue, and there is nothing about it, even if it is IND. But we want to give this message that ultrasound guided needle aspiration and sometimes even clinical guided needle aspiration works very well, and this is the thing that how we give, and it should be a broad, it should not be a thin needle, it should be the broad one. So I think this has been done, the postnatal, that we have to make बच्चा 5-6 बार यूरिन कर रहा है, वजन बढ़ रहा है, it's okay, don't leave the thing. A word about this thing, mother's milk versus formula. I think we have covered how it is good because it is the formula is same, but the mother's breast milk is changing every day. And how the other species, गाय भैंस बकरी का दूध क्यों नहीं अच्छा है, क्योंकि उन लोगों के कॉग्निटिव फंक्शन की रिक्वायरमेंट अलग होती है और इंसान के बच्चे की अलग होती है. तो ये सब छोटी छोटी बातें जो हम लोगों को बता सकते हैं. लोग कहते हैं गाय का दूध है, मेरे घर की गाय, अच्छा तो है, लेकिन इट इज
cow milk allergy is also very common, ma'am. Cow milk allergy.
हाँ हाँ. एंड तो वी शुड बी लाइक, हमको एक लोगों की भाषा में बात करना जरूरी है, कठिन कठिन चीज नहीं बताने की जरूरत है, छोटी छोटी. एंड नाउ दिस इज द लास्ट पार्ट ऑफ द पैनल. योर की मैसेजेस फॉर द लेजिस्लेटर, policy maker, community and people, and we will come to everybody. This is the open thing. We will start from Tulika, who is from West Bengal, जहाँ पे सबसे ज्यादा अधिकारों की बात होती है, उसको फॉलो होता है कि नहीं नहीं मालूम. So what's your take away about the maternity leave, unorganized center? क्या लड़कियों के लिए इतना आसान है जितना हम सोचते हैं कि उनका रिप्रोडक्टिव फंक्शन एंड इट्स देयर ड्यूटी. So what you say, Tulika?
गवर्नमेंट सेक्टर में तो फिर भी एक मेथड है, एक सिस्टम इन प्लेस है कि क्या करना है, कि छुट्टी के बारे में बोलिए या ब्रेस्ट फीडिंग प्रैक्टिसेस के बारे में बोलिए. वी नीड टू कॉन्सेंट्रेट ऑन प्राइवेट हॉस्पिटल्स and also on the unorganized sector. Private hospitals में because वहाँ पे breast feeding initiative जो है वो follow नहीं हो रहा है, क्योंकि मैं private practice भी करती हूँ तो वहाँ से मेरा experience है, and we have been talking to the people and commercial interests आ ही जाते हैं. शायद नीकू में रहने से फायदा ज्यादा है, बच्चा मम्मी के पास रहे तो थोड़ा कम हो जाता है इनकम, तो उस हिसाब से तो that is something where we need to concentrate and we need to act also. और अनऑर्गेनाइज सेक्टर का तो बिल्कुल, जो खास करके गवर्नमेंट हॉस्पिटल्स में जो आती हैं, जो लोगों के घर में काम करती हैं, या उनको 6 महीने कहाँ से छुट्टी मिलेगी, तो उनको एक चीज मैंने इफ दे कम इन कॉन्टैक्ट विथ मी, मैं हमेशा बोलती हूँ कि यू कैन एक्सप्रेस ब्रेस्ट मिल्क एंड कीप इट इन द फ्रिज. बिना फ्रिज के भी 24 घंटे रख सकती हो घर. लेकिन हाँ, जैसा एकिका ने कहा था कि फैमिली सपोर्ट बहुत जरूरी होता है, बिकॉज अगर माँ अपना ब्रेस्ट मिल्क एक्सप्रेस करके रख के भी आए घर में, तो द अदर मेंबर्स हैव टू टेक द इनिशिएटिव टू फीड इट टाइम बाउंड बने, जैसे होता है डिमांड फीडिंग. सो एंड रेस्ट फॉर द मदर्स एंड एवरीथिंग, दिस इज अ बिग थिंग. सो सबका हेल्प जरूरी होता है.
What happens that women actually, what in COVID women lost their job, and when the women get in the reproductive life, they are much behind in the career because we are actually not supporting in their career building, and they do, the companies, even the corporate multinational companies, what is the unorganized center, they don't want to give salary, because दो लड़कियों को तो हमेशा बच्चा पालना होता है. This is the way, because it is the, like, no, you know, the world is still too much politically dominated and by men, and now only the world has just little started that investing on women is the best investment. So baby formula feed, मोहित आपसे थोड़ा पूछेंगे, और शैली पौरिश, हम लोगों का क्या रोल है फॉर्मूला फीड को बढ़ाने में? मोहित एंड शैली.
मैम कहीं ना कहीं हम लोगों का भी रोल है इसमें, बिकॉज हम खुद ही गिव इन कर जाते हैं जब पेशेंट ज्यादा प्रेशर बनाता है. इसे एक बार दे दें क्या, इसे बस रात को एक बार पिला दें क्या. तो उसी वही मोमेंट है मैम जिसपे हमें अपने अंदर भी कॉन्फिडेंस रखना चाहिए कि नहीं, ब्रेस्ट मिल्क इस बेबी के लिए सफिशिएंट है. और जब हम खुद में कॉन्फिडेंट होंगे तब प्रोबेबली हम वो कॉन्फिडेंस पेरेंट्स को और फैमिली को ट्रांसफर कर पाएंगे. And this transfer of confidence is very important.
Thank you very much, Mohit. Very nice. Yes.
Yes, ma'am. I agree with Dr. Mohit fully. And a strong implementation of IMS Act is very important, ma'am.
Very, very important. We are, India is quite what Mahima says. It is around 9 and now it is 8.5, which I came to know. India is doing good, but actually the baby friendly, what we say in a very high corporate hospital, it is not so. Private sectors varies according there is, but we have to be very careful about it. And it is India update that the maternity protection is 3.5 by 20, and what Mahima says, we are ranking very less in the maternity protection, that is 3.5 out of 10. And हम लोगों की society, like, we don't support handicapped babies, we don't support handicapped person, and we also don't support the breastfeeding mother. So crash parenthood for the nursing break, promote action by employers, and the, like, supporting what it is everybody's responsibility. So thank you very much for all the panelists for your wonderful.
Thank you so much, ma'am. Thank you so much, ma'am.
Thank you so much, ma'am.
So it is the way forward. Just by meditating, concluding, professional bodies, association, community, we have to teach ourselves. We are together. It was a real wonderful sharing from all the panelists from every part, Punjab, Noida, Delhi, NCR, then Kolkata, and from our region. We have to reach the community, and community will enrich you. These are the sound steps: disseminate evidence, positive societal attitude. This is very important. Demonstrate political will, regulate breast milk substitute industry, scale up and monitor breastfeeding program, and enable intervention. So this is our commitment. That is the lack of commitment. Gandhi says, the one thing we can do, that educate people how they can be healthy. And at present, medicine is a very high technical affair, और हम चाहते हैं कि people are dependent on us for everything, and that attitude should be there. And what Mahima says, that what is the USAID target, 50% or 60% breastfeeding, and even this bar is very low. Thank you very much. We have been fortunate to having so many.
I want to add one thing.
Yes.
That if when cow and buffalo can feed their babies, then why not human beings who are getting
human beings have their ambitions,
much brain.
Complicated
Cow and buffalo are not feeding them on the bus.
No, but Sangeeta, human peoples are very, very complicated. We have made our life very complicated. We cannot do. So
and nowadays we are coming with the induced breastfeeding also in the surrogate mothers and in IVF, that adopted children.
So
adopted mothers induced.
The last one line, Sangeeta, you have started, and one line from all the panelists, that what is practical step we can do to achieve our results. And I will not say, we will start right from Sangeeta has started, and please come volunteer yourself for the last message. One line.
We can start counseling that IQ level will be more if the mother will feed breastfed exclusively, and till 2 years or more if the baby is taking a mother's breast milk.
Yes,
and
thank you.
also,
Next, please.
And also,
panelist, one line message.
Let's break the taboo related to the breastfeeding issues and make it a smooth journey for all the females.
Yes, next.
Counseling in the antenatal period, it should start from the antenatal period and also include family members, so that it can continue even after birth. और just एक line मैं add करना चाहती हूँ, while explaining to the mothers, many a times मैं बोलती हूँ कि formula feed है बिरयानी और breast milk है घर की दाल चावल. तो खाने में तो बिरयानी अच्छी लगती है बच्चे, लेकिन फायदामंद दाल चावल ही है. इसीलिए तुम सोच लो, the choice is yours कि तुम्हें दाल चावल रोज खिलाना बच्चे को कि बिरयानी या जो भी बोलो.
कुछ भी हो सकता है, वो बिरयानी ऑप्ट कर सकते हैं. ये थोड़ा
खाना चाहिए,
डेंजरस
स्विगी
है.
का जमाना है.
ये थोड़ा डेंजरस है. और नेक्स्ट another
involve root level workers in propagation of this breastfeeding milk, like
Caste
Asha
shifting
Bahu.
and caste
This is the
shifting and
important,
caste
because they
shifting
can
very
go to their homes. Because they can go to their homes.
No, should actually caste shifting is very, very important. Another, yes, thank you very much for it. Next,
Breastfeeding is a
use
woman's
the-
right. So we
राइट की बात नहीं करी, अभी ड्यूटीज की बात करते हैं. ये भी आज के समाज की प्रॉब्लम है. एवरीबॉडी इज फॉलिंग फॉर राइट, बट असल में हम सब लोगों को ड्यूटीज करनी है, मदर के लिए, चाइल्ड के लिए.
we have to do it as a shared responsibility.
Yes, duties. It is too much of right. So I think thank you very much. And again, I seek your full-hearted support for my upcoming election as a President Foxy. Thank you very much. And we are a little late, but I hope the people who are with us must be enjoying the very, very important like contribution, sharing of experience and wisdom for the panel. So
Thank you so much, ma'am.
Thank you so much. Thank you. It was very interesting and interactive.
Thank you, ma'am.
Very well conducted.
Part of this
Sadhana.
panel.
Thank you, everyone.
Getting to know what are the
thank
newer innovative techniques which all of our colleagues are practicing at their level.
And we should make we should be continue, we stay connected, stay stronger. So over to Babita and Aruna.
Yes, ma'am.
Request.
So indeed, it was a very interactive session and with so many new messages and eye openers. I would like to go for the official vote of thanks. I would like to thank Dr. Madhuri Patel, our chief guest, Dr. Tarini Taneja and Dr. Sneha Bhuriyar, who have taken out from the precious time and they have shared their experiences with us. I would like to thank our chairpersons, Dr. Sunita Kumar, Dr. Mala Srivastav, and Dr. Radha Jina for introducing and concluding the subject so well and giving their valuable inputs. And of course, our very dynamic speaker, Dr. Mahima Mittal, who has given us very important reviews regarding the journey of breastfeeding program in India. Her talk was a bit different and really very innovative. And of course, our moderator, organizer, chief, our star performer, I know I can go on endlessly for ma'am. I have so many adjectives for her. Thank you, ma'am, so much for conducting so many useful webinars and giving opportunity to almost everyone all over India. Like even the youngsters in your webinars and even to the seniors, like you've involved your like united India into a whole of Indian, India gynecologists into a single platform. That's a big deal and it's a big round of applause. And of course, our energetic panelists, Dr. Ekika, Dr. Ritu Sinha, Dr. Geeta, Dr. Sunita Kumar, Dr. Mohit, Dr. Shelly, both the Shelly Square, Dr. Sangeeta and Dr. Tulika Jain. Not to forget our Dr. Reena Srivastav, our patron, and President Gorakhpur Menopause Society, President of GOGS, Dr. Amrita Jaipuriar, and our Secretary, Dr. Aruna Chaparia. A very big thanks to the technical support team who has worked so well to run this program smoothly without any interruptions. A big thanks to all of you once again. And we hope to see Sadhana Madam at the highest position of Foxy and even beyond that.
Yes.
India is not barrier for ma'am. The whole world deserves her. Thank you so much, ma'am.
Thank you,
Thank you, everybody.
Thank you, ma'am.
Thank you, ma'am.